chamber quietly leave the chamber. We now come to the second opposition day motion on the access to primary health care. I inform the House that I've selected Amendment A, tabled in the name of the Prime Minister, and I call Helen Morgan to move the motion.
Thank you very much, Madam Deputy Speaker. It's a real honour to be opening this debate on our first opposition day for 15 years. And it's a particular honour to be opening the debate because primary care is the front door to the health service. And for too many at the moment, that door is closed. Whether you're waking up and dealing with the 8 a.m. calling frenzy to get a GP appointment, frantically ringing every dental practice in your area for an NHS dentist, or turning up at your local pharmacy to pick up a prescription for a loved one or yourself and finding it unexpectedly closed or the medicine out of stock. Primary care is in terrible trouble and it needs fixing urgently. Now, obviously, it's not only to make lives better for the people who are suffering because they can't access the primary care that they need, but it's also to allow the NHS to function more efficiently. A&E is not a decent substitute door to the NHS. I'm an asthmatic, and as a young person had quite serious asthma, and I can remember when primary care was absolutely there for me in the middle of the night. Lots of occasions I needed some help. My dad didn't have to drive me to the hospital in an ambulance. Somebody came to me with a nebuliser, got me sorted out within a couple of hours, and we went back to bed. Now, that's not an option for a lot of people. The NHS is in a crisis, and it's causing pain and suffering unnecessarily. But it's also costing far more than we can afford. And it's costing because early intervention and dealing with people in their community or at their home is so much more efficient than taking somebody to hospital, even if that is in a private car. And it's costly because it causes people genuine pain. The BBC reported in my constituency in Oswestry this year that a man removed his molar with a pair of pliers because he couldn't find an NHS dentist. And it's costly in cash terms, it's costly in terms of personal pain, but it's also costly because people are unable to access work, and it's costing the economy. Polling commissioned by Lib Dem showed that 1 in 4 people have been unable to go to work while waiting for some sort of primary care appointment. And that's really not good for an economy that urgently needs to grow. So that's why we need urgent investment in primary care, in doctors, in dentists, and in community pharmacists to save people from having to go to hospital. I will give way.
Thank you very much to the Honourable Lady for giving way and for securing this important debate. And she mentions pharmacies. A new report by Healthwatch England reveals a worrying picture of pharmacy closures and reduced hours hitting older people and rural communities the hardest. And Norfolk and Waveney Integrated Care Board, which covers much of my constituency, reported the highest number of hours lost per pharmacy. Does the Honourable Member agree that we urgently need a national evaluation of pharmacy funding, including the size, role mix and distribution of the pharmacy workforce?
Well, I thank you for his intervention. It's a really important point. In my constituency, carers turn up to pick up prescription medicine for the people they look after, and the pharmacist isn't there because they're relying on locums. The funding problem for pharmacists really does need to be addressed urgently, and I will come on to that later in my speech. Where was I? Growing the economy is so important, and we need to get people back into work and off the waiting list and off the referral list as well. Liberals believe that people should be in control of their own lives and not chained up in home, unable to get out of bed because they can't access healthcare. They need to be able to get the help they need in their own community, in their own home, and when they need it as well. So let's start with GPs. Liberal Democrats, in their manifesto, which was well received, that's why there are so many people sitting behind me on these benches right now, called for the right to see a GP within 7 days, or 24 hours if it's urgent, and if you're over 70 or have a chronic health condition, to be able to access a named GP. And those calls are extremely important. If you have the same GP for more than 15 years, you have a 25% lower chance of dying than if you've only had a new GP in the last year. And certainly local health, the primary care network tell me that the inability that they have to deliver continuity of care because of the shortage of GPs is one of the things that worries them most.
Will my friend give way?
I will give way.
Extremely grateful to my friend who's making a brilliant introductory speech. Is she aware that perhaps only a third of those people leaving medical school and seeking to go into general practice are actually able to find a job? And one of the problems is because the additional roles reimbursement scheme, which does exist, isn't allowed to be extended to recruit some of those GPs. Isn't it a madness that we're creating enough GPs through medical school, but because of the funding mechanisms that we've inherited, this government inherited from the last one, we're not able to recruit and to give those people jobs. We're losing them from general practice, indeed sometimes losing them from the country altogether.
Oh, well, he's absolutely right. I do believe the government have taken steps to address that, but flexibility of GP funding is a really, really important point. And that point where a GP's got money to spend on professionals, they need more actual, fully qualified doctors to deal with their patient list, but they're only able to spend it on another pharmacist or another nurse is ridiculous. And I'm pleased to see that the government have addressed that problem. I am going to make some progress, if that's okay. Where was I? Yes, you are doing much better if you can access a continuity of care through your GP, and 8,000 more GPs are needed to deliver the rights that we laid out in our manifesto. We don't shy away from the fact that that's an ambitious objective and that it can't be done through training and recruitment alone, that we need to retain and incentivise our existing workforce. As I mentioned before, seeing people in your community avoids hospital admission, it saves money. But unfortunately, although the Conservatives promised us 6,000 more GPs in 2019, we ended up with 500 fewer. And it's why people are so frustrated. GP funding has fallen in real terms by £350 million since 2019, according to House of Commons Library Research. And it means not only that people are struggling to access basic care in their community, but there's a real postcode lottery for the quality or availability, I should say, of that care as well. If we look at where I live, which is covered by Shropshire, Telford and Wrekin ICB, the fully qualified GPs have fallen from 280 in 2016 to 242 in 2023. That's despite an increased population and an increasingly ageing population with a much higher level of demand. 43% of patients are waiting more than 28 days for a non-urgent appointment where I live. The Darcy report showed that people waiting for long periods of time to get an appointment are going up across the country. It's a national issue. And we know that from our own doorstep conversations. Now, you might rightly ask me, where are you going to get 8,000 more GPs from? That's a big number. And the answer is, as I mentioned before, we can't train new ones, and we should value very highly our experienced ones. So a recruitment and training programme is one thing. Using the ones that we've trained properly, as my honourable friend pointed out, is extremely important as well. But we also need to focus on retention and incentivising our existing GPs to make sure that we hold on to that valuable experience and also that valuable patient continuity. Let me move on from GPs to the local pharmacy. Now, Pharmacy First, I think, was a great idea of the previous government. I'm willing to give them that. But pharmacies are under huge strain. 1,200 have closed since 2017, according to the Darcy report, and spending under the community contract has fallen. I'm going to visit tomorrow Green End Pharmacy in Whitchurch in my constituency, who wrote to me to say, as an independent pharmacy, we're unable to keep on absorbing costs with losses on dispensing. They're struggling because they're actually making losses on the drugs that they give out on prescription, and being a small independent pharmacy, they don't have a massive shop to make profits from to subsidise that work. In 2023, Community Pharmacy England warned of systemic pharmacy funding cuts of at least 25% in real terms since 2015. It's led us to a postcode lottery of access, to many pharmacies being unable to have a full-time pharmacist and relying on locums, which has led to a really poor and insecure level of service, and it's impacting people who just need to go and pick up their prescription and get on with their day. I will give way.
Honourable friend for giving way. I'm obviously here as the MP for North East Fife, and the NHS is devolved in Scotland, but the UK Government does have responsibility for continuity of supply of medications. And I've got ADHD constituents in my constituency who've been waiting up to a year to ensure that they have that continuity of supply. Does she agree with me that we need to see more action from the Government in terms of being proactive in that regard?
Yeah. Well, I thank you for your intervention. I think that's a really important point. We've got lots of people who've contacted me for help in my constituency, for help with drugs, for example, to deal with ADHD, really important medication that people need to be able to access readily. But I just want to move on to dentists as well. We mustn't forget the dentistry element of primary care. There's a generation of children at risk of poor oral health because of the mess that dentistry has been left in by the previous government. Tooth decay is the biggest cause for children to be admitted to hospital, with over 100,000 children admitted to hospital since 2018. That is totally unacceptable, Madam Deputy Speaker. 4.4 million children haven't been seen by an NHS dentist in the last year, according to the House of Commons Library. And of course, children are really important. They've got to keep their teeth for the rest of their lives, but it's affecting adults as well. In my constituency, Ron Kelly is 62, he's disabled, and he lives in Market Drayton. And those of you that have been around a little while might know that it's not easy to catch a bus anywhere from Market Drayton. He's been trying since 2019 to find an NHS dentist, and he still hasn't been able to find one. And my caseworkers have rung every NHS dentist in our constituency. None of them are taking on new patients, so even if he was able to use the bus, he wouldn't be able to find an NHS dentist in North Shropshire at the moment. ONS data released last week said that in the Midlands, 99% of people who don't have an NHS dentist and are trying to find an appointment can't access one. 99%. It's just unbelievable in a modern country in the 21st century.
Will the Honourable Lady give way?
I will give way.
Thank you very much. You mentioned dentistry and the challenges that many of all of our constituents are suffering trying to get access to NHS dentistry. And I'm thinking about some of my own constituents who have talked to me and indeed shown me their own home dentistry results. Yes. Will she agree with me that we should learn about good practice that is taking place across the country? In my own area in Greater Manchester, my Hazel Grove constituents were struggling to find dentistry, but because of some reallocating of existing funding in Greater Manchester, new appointments have been made available. And does she agree with me that we should look at good practice to learn what can be delivered elsewhere across the country?
Well, I thank you for your intervention, and I think flexibility of contracting is really critical, and obviously learning best practice from elsewhere in the country will help with this problem. But I just want to highlight how silly this problem is, that people can't find an NHS dentist when they need one, because actually NHS dental funding is going unspent. In Shropshire, Telford and Wrekin, the one I know about, £1 million was clawed back in 2022-23 because the dentists were just unable to spend the money that was allocated to them. That's because they don't have enough dentists to work on the contracts with them. I met someone last year who hadn't had a day off work. We were in October by that point, and he had to hand back his contract. Now, golden handshakes are one method that have been proposed by the government, but certainly in Shropshire, I've heard on the ground that they don't work, because actually what we need is a reformed contract, flexible commissioning, a proper statutory requirement for workforce planning, and ability of dentists to use their funding to manage their own practices in a way that allows them to make a bit of money out of treating patients on the NHS. I also just want to highlight the reversal of the public health grant cuts by the Conservatives and how important reversing them is, because it's a complete false economy to cut programmes that help with oral health and prevent poor teeth and bad problems with dentistry in the future, when you could spend the money up front and it would cost you far less going forward. We also called for measures enabling a guarantee. I will just make some progress now, if that's okay, because I'm conscious that there are lots of people who want to get in and make full speeches. Measures enabling a guarantee for urgent and emergency dental care, check-ups for those people who are already eligible, and those needing check-ups before things like chemotherapy and surgery were also in our manifesto. And it's only going to be possible to offer those guarantees if we deal with the issues in the dental contract and the flexibility of commissioning. So in conclusion, Primary care, as I mentioned at the beginning, is the front door to the NHS. Lord Darcy pointed out in his report, it's where we should be investing. At the moment, money is flowing to secondary care to hospitals, and yet most people's experience of the NHS is with their doctor or dentist. We must ensure that that first point of call is a good point of call and reduce the numbers of people going through to A&E. It's just so more cost effective, but it's also so much better for those people who could manage their health condition without a crisis, without ever having to get near a hospital. And we should just think of the knock-on impacts on those hospitals. We've all got horror stories of ambulances queued up outside hospitals because so many people are in A&E and so few people can flow through the hospital. Now, the issues around that are complex and link into social care as well. But the reality is, if we can treat people in the community, we will save the lives of people who need emergency care.
Yeah, that's right.
It's absolutely fundamental. So we need investment in our GPs. We need investment in dental and pharmacy contracts because we can't afford not to do it. I will give way.
I appreciate my honourable member giving way. I'd just like to add, in addition to pharmacists and dentists, I would like to say about my profession, optometrists can really play a role in reducing the strain on primary care and secondary care as well.
Well, I thank him for his intervention. It's an important point, and I apologise for not making that in my speech, but optometry is really important, and as somebody who spends their whole life looking for the glasses, I can absolutely appreciate his point.
Other opticians are available.
Other opticians are available. But I did. Liberal Democrats have suggested solutions to these problems in our manifesto, and they have been well received. As I mentioned before, we have a record number of MPs, and that's because we put this issue front and centre of our election pledge. So I urge the government to reverse the catastrophic state that the NHS has been left in by the Conservatives, to take our ideas on board and to invest in primary care as soon as possible. Thank you.
The question is, as on the order paper, before I call the Minister, can I just respectfully point out to members there are a huge number who wish to speak, and interventions are only going to eat up the time that is available to both colleagues and indeed, in some instances, themselves. I call the Minister Karin Smyth to move the amendment.
Thank you, Madam Deputy Speaker, and I shall here recognise that there are so many people who want to speak, so I will be as brief as possible. I beg to move the amendment standing in the name of the Prime Minister on the order paper. Madam Deputy Speaker, I'd like to begin by thanking the Honourable Member for North Shropshire for tabling this debate, and I think she does speak for us all. Firstly, when she spends a lot of time looking for her glasses, I recently decided to go for the varifocal option just to avoid that same problem, but also, as she said in her opening remarks, that we all know when primary care is there for us how great it is, and I'm very proud myself to have worked with primary care across the piece in South Bristol for many years. And although we are on opposite sides of this chamber, I think we can agree that the last government broke primary care at the same time it was breaking the NHS. And throughout my time in opposition and in my first 3 months in government, I simply haven't met or spoken to a GP or a pharmacist or a dentist or indeed anyone else working in primary care to say everything is going swimmingly, my patients are happy, this is exactly what I signed up for. And as Lord Darcy's review tells us, the same story, setting out that enormous charge sheet, which we still haven't heard if the party opposite agree with, or indeed if they're going to apologise for. The list is far too long to list here in full. Hospital, workforces and budgets shot up, yet full-time equivalent GP numbers have been allowed to shrink by over 1,500 in the last 7 years. Repeated promises to shift resources to the community have been repeatedly broken. And our primary care estate isn't fit for purpose, with 1 in 5 general practice buildings, and this is really shocking, isn't it, older than the NHS itself.
I'm very grateful to the Minister for giving way. She may be aware that for the best part of a year and a half, I have been lobbying ministers in the previous government, in the Department of Health and the Treasury, to review outdated Treasury rules that are preventing GP practices that want to move in a city centre to stay in a city centre, because the outdated rules force them to move to ring road locations away from the populations they serve. Could I please seek an assurance from the Minister that she will look with fresh eyes, with her new glasses, at this issue and work with Treasury colleagues to review these outdated rules?
Minister.
I thank her for her intervention and her assiduous work in opposition. Looking at the capital estate is also one of my favourite things and one of my new responsibilities. And our commitment to a neighbourhood service absolutely means that we need to bring services together and look at that in the piece to have primary care where it's needed with those populations. We often hear about hard-to-reach groups. I don't think they're that hard to reach, frankly. I think sometimes services are in the wrong area, and our commitment as one of our key shifts to shift services into the community and a neighbourhood service programme is absolutely part of that. Just 3 in 10 dentists, NHS dentists, are accepting new adult patients, and geographical inequalities are vast. More than 1,200 pharmacies have shut their doors for good since 2017. Public satisfaction, and again, the record speaks for itself, doesn't it? Public satisfaction with general practice has fallen from 80% in 2009 to just 35% last year. And if there's any indicator of why these benches in front of me are empty, that we all learnt back in July in that general election, it is that dissatisfaction with access to primary care that is so stark. Yeah. It is absolutely clear that primary care is broken, but NHS staff, those people in primary care didn't break it, the last government did. Yeah. They cut funding for the community pharmacy contract. They failed to incentivise enough dentists to perform NHS work, and they pursued a disastrous top-down reorganisation of the NHS with which we are still living. Now, they might have broken the NHS, but it is not beaten. NHS staff remain as passionate, dedicated and skillful as ever, and this government will work in lockstep with them, their counterparts in social care and local partners across the length and breadth of the country to fix the NHS. Now, this will take... I'm tempted, but I know lots of her colleagues want to speak, and I'm sure she's on the list. This will take years of disciplined, hard work, and we are in this for the long haul, Madam Deputy Speaker. Yeah. But first, we need to clean up the mess we inherited, and that work has begun in earnest. We found the funding to recruit those extra 1,000 GPs in this year as our first step to fixing the front door of the NHS, making that system more flexible. One from either side then, go on.
I'm very grateful for giving way. One of the key deliveries when it comes to GPs is the mechanism by which they set themselves up and the GP partnership model. Now, the Secretary of State has walked in and previously in 2023 said he wanted to phase out the GP partnership model. He did renege back on that position, but now he's in government. It'd be really interesting to know what the government perceives the best model is to delivering primary care, because for GP partners, that's really important.
Well, I thank him for, I wish him well and his own access to his GP at the moment. That we are absolutely committed to working with the profession on the best way that they want to both organise. But the critical point is that primary care, however it's organised in neighbourhoods, is there for our constituents when we need them, and it isn't there now. The model isn't working. It hasn't worked over a period of time. It has merit. We have said that. We are continuing to talk to people. I have worked in this sector for a number of years, so I do understand the point the honourable gentleman is making. In our first week, we pledged to increase the proportion of NHS. I'm going to move on. I'll take one more from this side at some point, and then it's all fair. But I want to let people to speak. In our first week, we pledged to increase the proportion of NHS resources going into primary care. And in our first month, the government made a down payment on that pledge, providing GP practices with their biggest funding increase in years. But we're not just increasing the funding. We're also cutting the red tape that stops many staff doing their jobs. Some GP practices are currently having to fill in over 100 different forms to refer patients into secondary care services, and they are spending as much as 20% of their time on work created by poor communications with their secondary care colleagues. I mean, this is totally nonsensical in 2024, and it has to change. Time doing needless paperwork and bureaucracy means missed appointments lost for patients. And that's why we've launched a red tape challenge to bulldoze bureaucracy and free up GPs to deliver more appointments. It will be led by Claire Fuller and Stella Wieg, really established leaders in primary and secondary care. They will check with staff what's working well and what needs to change, so we can take the best of the NHS to the rest of the NHS. Initiatives like Consultant Connect in South London allow GPs to talk to mental health consultants in real time, reducing the number of referrals they have to make by 40%. Now, delivered across the country, schemes like this could save thousands of hours of time and create thousands of new appointments. That's what our red tape challenge is all about. We want to help patients see specialists faster. Starting in November, 111 Online will pilot directly referring women with a worrying lump to a breast clinic. This means faster diagnosis for cancer patients and more GP appointments freed up. Better for patients and better for GPs. On dentistry, as the Honourable Lady outlined, we inherited an NHS dentistry system in disrepair, thanks to 14 years of chaos, failure and neglect. It is a national scandal, but we do need to keep reminding the party opposite. It's a national scandal that tooth decay is the leading cause of hospital admission for 5 to 9-year-olds, and we all see it in our constituencies. The last government broke their relationship with the British Dental Association, as they broke so many relationships, and during the election campaign we pledged to meet them immediately upon taking office to start rebuilding it, and that's exactly what we did. The British Dental Association is right. The last government's dentist recovery plan didn't go far enough. Now, we are keeping parts that are right solutions, and we do think the Golden Hello, along with other measures, is part of that, but we do want to go further and deliver an NHS rescue plan that gets dentistry back on its feet. And we are working around the clock to end the truly Dickensian tooth decay that is blighting our children. As well as our additional urgent appointments for all ages, we will work with local authorities to introduce supervised toothbrushing for 3 to 5-year-olds in our most deprived communities, and we will see the difference that makes, getting them into healthy life habits, protecting their teeth from decay, and ending the national scandal the last government presided over. On pharmacy, previous governments dithered and delayed, failing to find a sustainable and long-term funding solution. Now, NHS England is working with the sector to assess the cost of providing pharmaceutical services, and we look forward to seeing its outcome. And consultation around this year's funding and contractual arrangements with the Community Pharmacy England didn't make it over the line before the election was called, so we're looking at that as a matter of urgency. We want to continue to make it easier for pharmacists to take referrals and support people with common conditions, using prescribing skills to treat a wider range of conditions and patients. They are highly skilled people in our communities, and allowing them to get the care people need in the community, saving time and freeing up GP appointments again and using those pharmacy skills will be really helpful for the wider system. Now, those are our first steps, Madam Deputy Speaker, and primary care is central to the 3 big shifts that underpin our 10-year plan to make the NHS fit for the future, taking it from analogue to digital, from sickness to prevention, and from hospital to community. We will soon begin a public consultation that will be the biggest listening exercise in NHS history. I'm looking forward to taking part in that, and I urge honourable and right honourable members across this House and their constituents and staff across primary care to tell us what's working and what needs to change. We will use their responses to take the best of the NHS to the rest of the NHS and build a neighbourhood health service, where technology helps doctors, dentists and pharmacists meet demand for same-day appointments, giving patients a digital front door to end in the 8 a.m. scramble, where big data will end the cruel postcode lottery of health inequality, so we can take screening, checks and care directly to communities that need it most, intervening early to prevent ill health and deterioration. Where colleagues from across primary care come together with their partners in social care and mental health to work lockstep, we want them to work as one team to treat patients in the comfort of their homes where they want to be. That's the neighbourhood health service we want to build. That's the future our constituents want to hear. So in the interest of time, Madam Deputy Speaker, I want to say that our constituents were let down by the last government. They were let down by broken promises, underfunding and a failure to listen to patients and staff. But we will repair the damage. We've already begun investing in GPs and pharmacies to fix what's broken. We will cut the red tape, speed up treatment and build a neighbourhood health service that works for everyone. The NHS may be broken, but it is not beaten. We are determined to rebuild it for our people, our communities and our country.
The original question was as on the order paper, since when Amendment A has been proposed as on the order paper. The question is that the original words stand part of the question. Dr. Caroline Johnson.
Thank you, Madam Deputy Speaker. As a doctor myself, I want to start by recognising the substantial work ethic and the expertise of my primary care colleagues and thank them for all that they do. Saying what is wrong with the NHS is very easy. Solving problems takes much longer and is far more difficult. I expect that rather than the next few hours being filled with constructive ideas, we will simply hear complaints about the challenges faced by the NHS, perhaps some party political jibes, and a wish list of promises and desires of people, things that people want to see, but no concrete plans on how to deliver them, beyond more money. I hope I'll be wrong about that, but I suspect that I'm right. Our NHS is facing significant challenges. We have an ageing population with more complex health needs, and a rising demand for services, and a rapidly growing population. We also have the legacy of the pandemic, which many are quick to forget. Though we were the first country to deliver a vaccine, there are many persistent problems stemming from the pandemic. If I give the House an example, before the pandemic in 2019, there were 54 women who'd been waiting more than a year to see a gynaecologist. But due to the reduction in elective activity during the lockdown, by the time the pandemic was over, that number was more than 40,000. And this, of course, is replicated across other medical specialties. And whilst, of course, my secondary care colleagues have been working extremely hard to reduce those numbers, and indeed they have fallen, the individuals concerned will on average visit their GP more while they're waiting, and this inevitably puts more pressure on the primary care services whilst people are waiting. The simple truth is we gave the NHS more money than it's ever had. The NHS has delivered more clinical activity than ever before. However, the ageing population, the rising demand for services, and the legacy of the pandemic has meant that in places this has not been enough. Many people are not being seen as quickly as we would all like them to be. The Labour administration, previous Labour administration, didn't do enough to train new doctors. And the reality is that you cannot train one overnight. The Conservative government built 5 new medical schools, and the graduates of these medical schools have recently started work. The Secretary of State says he's going to double the number of medical students. This is an item on his wish list, which I agree with. But I do have some questions. Is he going to build new medical schools, or expand the old ones, or both? If he's going to build new ones, where is he going to build them? Primary care, the Honourable Lady is talking about primary care. I believe doctors are a part of primary care. But I do have some questions. The UCAS deadline to apply for most medical school places to start next autumn was actually yesterday. So when does he expect these new places to be available and those new students to start? On the broader primary care workforce, we expanded the number of primary care professionals in GP practice, such as dietitians and physiotherapists. And we delivered 50 million more GP appointments last year than in 2019. We also saw oversaw the launch of Pharmacy First, delivering more care in the communities whilst easing pressure on GP appointments. And I was pleased to see the Liberal Democrat spokesman acknowledge the success and the benefits of this programme. A few questions for the Secretary of State. The Conservatives produced the first NHS workforce plan. Can the right honourable gentleman say if he'll proceed with these plans or if he will write a new one? And what are the timescales for his plan? In the spring budget, we had the NHS productivity plan, £3.4 billion to improve the NHS productivity. Does he still intend to follow this? The Honourable Lady said that she was recruiting 1,000 GPs. Could he tell us how many GPs he has recruited so far? Something else that the Secretary of State and I agree on is the ability of technology to improve NHS services. I'll give way.
I'm very, as a new member, I'm learning how this place works, so I'm very interested to see how much you expect a Labour government to have achieved in 100 days. Why is it, after 14 years, you left the country with the longest waiting lists ever and small children having to get their teeth seen at A&E where they turn up with rotten teeth at dentists? What can you actually say that's helpful to us in understanding why the failure of 14 years of Conservatism took place and whether you feel any remorse at all about that?
Shadow Minister returns to the dispatch box. Order. Several times, It's not me. I've never been a health minister. And can I just reiterate the point? Interventions are going to have to be short. I will be imposing a time limit, but we have an enormous number of members that we have to hear from this afternoon. Dr. Caroline Johnson.
Thank you, Madam Deputy Speaker. And I thank the Honourable Gentleman for his intervention. I think I've talked about the challenges that the NHS faces, and I will come shortly in my speech to the achievements of the Labour government so far in the Department of Health. So back to technology. I was saying that I agree with the Right Honourable Gentleman on the how technology can improve the NHS services. And over the last few years in my professional capacity, I've seen improvements in making communication between primary and secondary care and secondary care much more efficient. As a patient, I've used the Ask My GP service, which is an excellent way to communicate with your GP, particularly for people who are working. I've also used the NHS app, which millions of people have now downloaded, and which has huge potential. I hope the Secretary of State intends to build on that potential and harness the benefit of AI to diagnostics in particular. The Secretary of State and I also agree on the importance of prevention. It's vital to make the NHS accessible to those who need it, but it is even better if people stay healthy in the first place. Before the election, the Right Honourable Gentleman was supportive of measures to protect children from the dangers of vaping, measures that I campaigned very actively for. In fact, he was quite critical that it hadn't been done sooner, as in some respects was I. Given that the legislation has already been written and that it has passed both second reading and the committee stages with the support of his friends on the Labour benches, why is it taking him so long to produce a tobacco and vapes bill? Can he guarantee he will deliver it like a present in time for Christmas? And for clarity, Madam Deputy Speaker, I'm hoping for this Christmas. Furthermore, I've been a good girl, thank you, Secretary of State. Furthermore, can he explain how cancelling dozens of new hospitals will reduce pressure on general practice? Can he explain how cutting the winter fuel payment for millions of pensioners will help the NHS? The End Fuel Poverty Coalition predicts that Labour's winter fuel payment cut will result in an additional 262,000 pensioners needing NHS treatment because they are cold, resulting in a great deal of suffering and millions of pounds of additional cost to the NHS. Does he agree with this assessment? I've asked repeatedly, both in oral and written questions, if the government will conduct a proper impact assessment of this policy on the NHS and on the well-being of vulnerable older people. Will he commit to producing and publishing such a report? Further on the issue of prevention, the Right Honourable Member will know that folic acid supplementation can prevent neural tube disorders such as spina bifida and anencephaly. The previous government brought forward regulations on this. What conversations has he had with DEFRA about ensuring this work is continued? Our approach on dentistry has been underlined by prevention too. When we introduced the Health and Care Bill, that gave the Secretary of State the power to introduce water fluoridation schemes. These powers have since been used to propose extending existing schemes, particularly in the northeast of England. Does the Secretary of State intend to continue this work and to exercise the powers the previous government gave to him? The Right Honourable Gentleman knows I'm passionate about dentistry and raised the issue many times in the House, including having an adjournment debate on dentistry in Lincolnshire. It troubles me very greatly that children are coming to hospital for multiple dental extractions due to rotten teeth. It's worth noting that the issue is not a shortage of dentists overall, or as the lady from North Shropshire says, a shortage of money, but in fact a shortage of dentists doing NHS work rather than private work specifically. The previous government was encouraging dentists to take up NHS work with a range of measures, including golden hellos for dentists in underserved areas, dental vans going out to rural communities, and tie-ins for new dental graduates. We were also in the process of broader contract reform after a small change in the UDA rate when we went into the election. Let us look at Labour-run Wales by comparison. They're delivering only 58% of the pre-pandemic dental activity. They're burdened with the highest proportion of NHS dental practices not accepting adult patients and the longest waiting list in the UK. 1 in 4 Welsh residents are currently on a waiting list. The new Welsh Secretary has said the government will take inspiration from Labour-run Wales and dentistry. Given their woeful record in office, I sincerely hope this is not the case. Before the election, when I listened to the Right Honourable Secretary of State saying Labour had a plan to reform and modernise the NHS, I believed him that that was the case. But in Monday's debate on the Lord Darcy report, we uncovered his plan wasn't really a plan at all, but a list of desired outcomes and a proposal to make a plan if he got into office. It's unclear how long this plan will take to develop. The Honourable Lady has said it's a listening exercise like I've never seen before, but how much will that cost, and had they not been listening already? I will give way.
Giving way. Why did the previous government shift the funding from secondary care to primary care, despite saying it was going to do exactly the opposite?
Essentially because the clinical acute need is most often seen in the secondary care hospitals where need is acute to save lives, and when given them the choice with one amount of money between saving a life and preventing a problem for later, it's inevitable that the money gets shifted towards acute care. That's where the pressure is. But I agree with the Honourable Gentleman that we need to work harder on prevention to prevent people becoming ill in the first place. On this point, no, I won't give any more because I know the Deputy Speaker will be giving me eyes if I do. Labour has spent 14 years in opposition. The Secretary of State has plenty of time to consider what he would do if he gained office. So, further to the Honourable Gentleman from earlier on's intervention, what have they achieved in their 14 weeks to help the health of the nation? I'll tell you, Mr Speaker, Madam Deputy Speaker, they've opened the department's doors to their Labour mates. They've awarded an inflation-busting pay rise to junior doctors without negotiating any modernisation or productivity reform in return. They've overseen GPs entering industrial action and nurses rejecting their pay offer. They've scrapped the social care cost cap. They've produced a report of selected statistics with no policy recommendations. They've broken their manifesto pledge to deliver the new hospitals programme. They've taken winter fuel payments from millions of vulnerable pensioners. And they've even, Madam Deputy Speaker, stopped the Children's Cancer Task Force. This dire record, underlined by the Labour legacy in Wales, fills me with huge trepidation for the future of the NHS. I hope that when the plan eventually does come, it's a good one for all our sakes.
Laura Kyrke-Smith.
Thank you, Madam Speaker. I hear from many constituents in Aylesbury who are struggling to see their GP. For some, this is a frustration, a repeated one. For others, it's a tragedy. I sat with a constituent who shared a heartbreaking story about a missed cancer diagnosis because it was impossible to get an appointment. The reason for the challenges are clear, as the Minister set out. In Aylesbury, 2 additional factors are creating particular pressures. First, the many new housing developments that have been built in the last 14 years without the necessary services to accompany them. For example, the promised GP surgery in Kingsbrook that was never built, adding pressure to other surgeries like Poplar Grove. And second, the high levels of deprivation in parts of Aylesbury. The well-documented link between poverty and ill health leads to patients having increased and complex physical and mental health needs that GP surgeries aren't funded or equipped to meet. Let's be clear about the cause of these challenges. It's not the fault of patients who, like all of us, are just trying to stay in good health. And it's not the fault of GPs, who often work incredibly long hours in a system that lets them down and wears them down. The problem is the broken system that this Labour government has inherited after 14 years of Conservative government. Yeah. The early steps, I'll turn to the solutions, the early steps that we've taken are a clear signal of our intent, ending the junior doctor strikes, the red tape challenge that the Secretary of State launched with NHS England, and the measures that we took within weeks of being elected, finding 82 million of additional funding to enable the recruitment of 1,000 more GPs immediately. And I know from the GPs that I'm in touch with that this has made a real difference. But the work still to do is great, and I want to highlight 3 necessary areas of focus. First, expanding the range of care available in the community. GP surgeries waste time referring patients to hospital-led community services when they know they could treat them directly, but they don't have the funding or the permission to do so. Meanwhile, patients tell me they've had to go to A&E for minor issues because there's no support closer to home. Our ambition is absolutely right, an expanded range of support and services through neighbourhood health centres, and we're getting straight to work on this. Second, technology. Time and again I hear of GPs spending hours trying to do referrals to and from the hospital, battling IT systems that aren't intuitive and don't speak to each other, and meanwhile patients tell me that they can't fathom why there's not a better system for booking appointments. There are some great pilot schemes that could be rolled out more widely. At the GP surgery in Aylesbury, in my constituency, for example, a carefully designed AI chatbot answers patients' questions where it can and helps GPs prioritise which patients to see. Third, and finally, we need a very firm emphasis on public health, on prevention, driving up public awareness of health risks. For example, the stand that I saw on a visit to the main mosque in Aylesbury recently with information about diabetes. This is exactly the right way to get the right information in front of people. And once public health risks are identified, we must empower patients to manage their own health as best possible. As Vernon Sharples, a mental health nurse in my constituency, said to me, there is too much prescribing, too much emphasis on being ill, and not enough emphasis on being and staying well. And this, to me, is what a good preventative approach looks like. Taking public health seriously, including mental health, and building a society that understands and promotes well-being, keeping people healthy before they need to seek treatment with a GP. Achieving this vision will take a long time, and change cannot come soon enough for people in my constituency who so desperately need to see their GP today or tomorrow. But we have started as we mean to go on, and we will not stop until we've achieved the change that we so desperately need. Thank you.
Yeah. Before I call the chair of the Health Select Committee, there will be a 3-minute time limit on backbench speeches and 6 minutes for maiden speeches. Layla Moran.
The challenges facing the NHS are no secret, and in my new role as chair, I've begun to meet with some of these key stakeholders. I have to say, the list of things that we need to look at is enormous. I just want to pay credit to those who I know stood for the committee, and welcome to those who have made it on. I understand that Conservative members have been chosen. I don't know who they are yet. Forgive me if they are here. I'm looking forward to getting cracking. I want to start by highlighting to ministers there are a few reports from the previous committee's work that I would urge them to look at. The first is on dentistry and the next is on pharmacies. These were from 2023 and 24. They're extremely current, and one of the things that is a note of frustration is in the dentistry report it points out that it's making the same recommendations that the committee made 15 years prior. I do hope that this government will take the recommendations of our committee extremely seriously. They are done cross-party, they are done thoughtfully, and we are here to help. But today I want to focus on the GP crisis. And the committee, and I take no credit for these reports, they were done under the previous committee, and credit to previous chairs and previous members of that committee. This dates from October 22. And it points out what we already know, which is that GPs are overstretched, patients are frustrated. The British Medical Association reports that a single GP now manages an average of 2,282 patients. That's a significant increase from 2015, and I know that there are even more acute numbers than that across the country. And this has led to longer waiting times and difficulty in accessing care. One of my constituents wrote to me about how his wife is struggling to book a GP appointment. They don't even take phone calls, or at least that's what the patient thought. They open an online form for a few minutes at 8 a.m. in the morning, and as soon as the appointments are gone, they close the form. We then called the practice. They did point out you could ring, although it would seem that that message is not getting across to patients, and I think that experience is being felt across the country. But I don't blame the GPs, because the GPs themselves are trying their very best. The Royal College of General Practitioners found that over 40% of GPs might leave within the next 5 years, stress being a key factor. And the crisis in general practice affects the entire NHS. When patients can't see a GP, they often turn to A&E, worsening pressures on emergency departments, and GPs play a vital role in managing long-term conditions and also coordinating social care at both ends of that flow of patients. Without a functioning general practice system, the entire healthcare ecosystem suffers. So what can be done? Well, the committee proposed 4 main things that I hope the ministers will take into their 10-year plan. 1, we need to urgently increase the number of fully qualified GPs in the system. That's more than just training them. The retention part is absolutely key. 2, we must embrace and improve digital health solutions, undertaking a full review of all primary care IT systems from the point of view of clinicians and patients. And we have to also accept that for some people, the digital just doesn't work. I will, of course.
I'm very grateful to the chair of the Select Committee. I was actually a member of the committee who helped author that. One of the key things that we want to see from the clinical perspective is being able to join up that IT side, but having a place to share technology is really important. For example, every GP practice suffers with how to set up their appointment system. Yet, bizarrely, if I wanted to set up as a GP on my own, there is no centre of excellence to say what's the best way to do this. Would you agree with me? This would be an extension to have a single point of expertise that you can refer to, each practice could go to ask to say what's the best solution we've seen elsewhere in the country.
For his work, the previous committee's work, and actually the GPs I've spoken to point to this report as, you know, what they would like to see done. So all credit to the ideas that have come out of it. The third is prevention, which is very much at the heart of the Darcy report. It makes clear that focusing on prevention and early intervention will relieve pressure in the NHS in the long run. But finally, I want to talk about continuity of care, which was a key theme and indeed an entire chapter in the report. It makes clear that seeing the same GP over a long period of time leads to fewer hospital visits, lower mortality and less costs to the NHS. This is not about some sort of nostalgic harking back to the way things used to be. If we want to solve, in my view, the biggest thesis question in the NHS now, the productivity issue within the NHS, then we need to be looking at interventions like this. Continuity of care within GP practices, understanding the whole person and the whole family is one of the ways that the report identified as making their time more productive. So the challenges are immense, but not insurmountable. We owe it to our healthcare professionals and, most importantly, the patients to fix this crisis. And I look forward to working collaboratively with my new members to help the government to do that.
James Frith.
Thank you, Madam Deputy Chair. Some of us newly elected or returning MPs have only just got accommodation and offices sorted out. And so can I commend the government at the speed with which it's got surgeons back to work, resolved the doctors' strike, reviewed and assessed the crisis and made announcements for a decade of national renewal, as well as affirming the view that our NHS is not to be treated as a shrine or be beyond question, but that one must be returned to deep service to our country and play its part as a health and economic public service. The Darcy Review for the government highlights the critical issues with this NHS review and the state we're in, particularly the underfunding of primary care, which has been neglected in favour of a creeping trend towards hospital services, a principle of leaving it late, a failed principle, this crisis mode setting that applied across our public services under the last government. By design, people ended up in A&E because of a failure to plan for GP and primary care. We've 16% fewer GPs than other high-income countries. The review also points out the significant health inequalities, with deprived areas receiving insufficient resources historically. In Bury North, child poverty is up to 43%. This is densely populated in just 3 of our 9 wards. Life expectancy for those living in Bury North ranges enormously. Life expectancy between North Manor and East Ward is 5 years for women and nearly 7 years for men living in East Bury.
My honourable friend give way.
Yes.
I thank my honourable friend for giving way. On the point of life expectancy, as we know, public health interventions cost only a quarter of clinical interventions to add an extra year to life expectancy. So would my honourable friend agree with me that the reduction of the public health grants was appalling false economy and should be restored as soon as finances allow to at least 2015-2016 levels of funding? Thank you.
My honourable colleague makes a very valid point. I defer to her knowledge of the public health system. So the distance between a mile or so has a huge impact for the men and women living in East Bury. So I urge the government review to see how, in constituencies like mine, specific interventions to address these deep health inequalities and the work that we need to do to resolve this densely populated impoverishment and ingrained health inequality. I urge the government also to adopt multidisciplinary care models and shift care closer to home to address these issues, as I know is the sentiment the front bench shares. Wider than this, the funding formulas are outdated and long overdue. An update that appreciates the weight of funding pressures for areas like mine with a mix of economic, demographic and inequality, including so much of the revenue our local authority raises being immediately swallowed up by adult care and the disastrous SEN system, a symptom of this crisis mode mentality under the last government. The government's not wasted any time, investing £82 million to recruit 1,000 newly qualified GPs, addressing the dental care crisis with 700,000 urgent dental appointments. The government also aims to expand the role of pharmacies, a measure I hugely welcome to reduce the burden on our GP and hospital care, and crucially also for those living with chronic illness or conditions. A boost to the engagement patients can make with health decision makers, via the NHS app, and an improved trusted status for healthcare professionals will boost this too and reduce the bureaucracy on our caring systems. There is a well-known saying, Madam Deputy Speaker, in good hospitals: the best hospitals keep people out of them and gets people out of them. And this principle strikes at the heart of what has gone wrong in recent years. The problems in A&E, emergency services and waiting times stem from a failure over the last 14 years to design by this doctrine. The key to resolving these issues lies in primary care, preventing people from needing hospital services in the first place and enabling faster discharges when they do. This is where the focus must be. Thank you.
Wera Hobhouse.
Deputy Speaker, and today I am speaking as the chair of the Eating Disorder APPG. Eating disorders are a national emergency. Hospital admissions have risen by 84% in the last 5 years, while over 80,000 sufferers are stuck on waiting lists while their condition gets seriously worse. Eating disorders are treatable, but the treatment must be timely and appropriate if sufferers are to make a full recovery. Early diagnosis is crucial. According to the charity Beat, approximately 1.25 million people in the UK have an eating disorder. And I'm sure many of my colleagues here have either been in touch with friends, family, a family member, or know about a constituent who is suffering from an eating disorder. The sooner someone with an eating disorder accesses the right treatment, the more likely they are to recover. When eating disorders are left undiagnosed or poorly treated, they can be killers. Eating disorders are the mental health disorder with the highest mortality rate. And there's still a stigma surrounding eating disorders. There are still too many who think that having an eating disorder is a choice. What a terrible thing to say about people who are suffering from an illness, that it is a choice. Only 6% of people with an eating disorder are underweight. Yet some eating disorder services and GP services still only offer treatment to patients depending on their BMI. Many eating disorder sufferers are told that they are too thin or not thin enough. Others are told once they return with an even lower BMI that they are too sick or too complex to be treated. And this only happens because too many sufferers are left untreated when full recovery was perfectly possible.
Will the Honourable Lady give way?
I would rather not, because we have got too many people wanting to speak. NHS waiting times are one of the biggest barriers to treatment. At the end of 2023-24, over 10,000 children had entered treatment for an eating disorder, but 12% of these were made to wait for over 3 months for treatment, 3 times the target for routine referral. Missing the target that is standard can severely harm the progress of a child's recovery. Even more shockingly, for adults, an access and waiting time standard does not even exist. Madam Deputy Speaker, I will continue to work tirelessly to improve eating disorder care, in particular fighting for improved access for treatment and for more suitable treatment options for individual patients. And we, the APBG, have just commissioned an inquiry, and I hope the government will carefully listen to the recommendations. Madam Deputy Speaker, in 2024, no one should be condemned to a life of illness, nor should anyone die of an eating disorder.
Before I call the next speaker, I'm going to give some helpful guidance to members still wishing to speak, that interventions are only going to eat up your own time and others' time and may well see you put to the bottom of the list. Josh Fenton-Glynn.
Thank you, Madam Deputy Speaker. I'm really glad this debate has been called, and I rise knowing that across this House the stories of failings in primary care are too familiar and frankly too distressing. Indeed, the Darcy report makes clear that since the announcement in the late 2000s of the so-called left shift, the shift from hospital care to care in the community, we have seen the number of people treated in hospitals rising. Indeed, now 58% of the NHS budget is spent in hospitals compared to 47% in the late 2000s. As Darcy said, no left shift, just a right drift. And let's be clear, GPs work hard and do a fantastic job. Just a few weeks ago, I visited the fantastic Hebden Bridge Group practice in my constituency. The 13 doctors there conduct around 2,000 appointments a week. And while they're fantastically efficient, it's taking its toll. The General Medical Council's National Training Survey, a report I used to be proud to work on every year, found that 68% of GP trainers said they always felt worn out at the end of the day. This is simply unsustainable. And we see the impact of the unsustainable model and the underfunding in our constituencies every week. In my constituency, the Calderdale Community Practice in Todmorden closed with over 2,800 patients on its books because there simply wasn't anyone able to take it on. I think the Darcy report makes clear that we need to prioritise primary care and care in the community. The left shift must not be a slogan, but create real action. And it cannot be right that last year 2,000 patients each day were admitted to hospital because of something that could have been treated elsewhere and closer to home. I look forward to supporting the government amendment today and working across the House week in, week out to make sure we rebuild the NHS and get it the support it needs. Thank you.
Chowns. Thank you, Madam Deputy Speaker. The Darcy report made very clear that our NHS is underfunded, overstretched and too hospital-focused. And that's been a focus of the debate today so far as well. I really welcome what I heard from the Secretary of State in the debate on the Darcy report last week, where he talked about investment and reform. He talked about a shift from hospital to community, from sickness to prevention. We all want those things, but they won't happen without more investment. And they won't happen without, I think, a crucial reform in the way that the NHS is funded, because we have seen this drift towards increasing focus on acute services, on hospital services, at the expense of the investment in the preventive healthcare and the primary services that we all recognise are so needed and that constituents in my constituency of North Herefordshire so desperately want. They want to be able to see a GP. They want to be able to see those community frontline services that will save their health in the long run and save the NHS money in the long run. So can the Minister assure me that she and her colleagues have been doing everything possible to urge the Chancellor to make the billions of pounds of investment in the NHS that is necessary to bring us back up to scratch in comparison with our peers? Darcy said we are underfunded in comparison with other similar health services. And will she assure me that the government is considering putting in place some sort of mechanism to protect funding for primary and community care, and indeed to ratchet it up over the years? Because the way things happen at the moment is hospitals constantly overspend, and those overspends are constantly plugged, and that is why the money is going more and more into hospitals, less and less into primary care. So will we get the billions of pounds of investment in the budget that we need? And will we get that protection and ratchet mechanism for primary care funding that's the only way to ensure that the extra doctors, the extra appointments and so forth are actually delivered? Thank you.
Costigan. Madam Speaker, there's an old Irish saying, your health is your wealth.
All the money in the world, all the nice things mean nothing if you don't have your health. And too many people in my constituency of Ealing Southall don't have good health. 10% have diabetes, higher than the London and UK average. And the rate of preventable deaths is almost 14% higher than the England average. But time and again, when I knock on doors across Ealing Southall, people tell me three things. They can't get a GP appointment when they need it, and then they can't see a doctor face to face. And if they're lucky enough to see a doctor, they never see the same one twice. With long-term conditions such as diabetes, not seeing the same doctor is literally damaging my constituents' health. They're getting sicker and they end up relying more on expensive hospital services. In Southall, emergency hospital admissions are 47% higher than the England average. So why can't my constituents get to see a doctor? Well, there simply aren't enough for starters. North West London has a ratio of 1 GP for every 2,268 patients, a lot worse than the UK average. Now, Madam Deputy Speaker, we've had 14 years of the Conservative Party running our NHS, and it's clear that they run it into the ground. They started with a big bang approach, with the disastrous top-down reorganisation of the NHS. This caused so much damage that they even recognised it in the end, and they had to dismantle many of the changes a few years later, but not before the rot had set in. Since then, their approach has been like moving the deck chairs on the Titanic. All that they can come up with is piecemeal tweaks and small pilots that never seem to amount to anything. In the meantime, the NHS ship is slowly sinking. Lord Darcy's independent and honest report found that patients have never been more dissatisfied with the services they receive. And I can only take the empty benches opposite as proof that you're finally embarrassed about this. And I thank the Madam Speaker for indulging me there. Madam Deputy Speaker, you've got to ask why the Conservative Party have been happy to preside over 14 years of decline in our NHS. Is it because they want the NHS to fail? Is it because they want to replace our NHS with privatised American-style insurance system? The mask slipped in COVID when they fast-tracked their healthcare mates, private healthcare mates, and handed them multi-million-pound contracts for often dodgy PPE. Was that the future they have in mind for the NHS? Well, it's not what the public wanted, and it's why the public voted them out. My constituents in Ealing Southall are already impressed by the new government's approach. They know the damage to the NHS is so deep it can't be fixed overnight. Mr. Speaker, your health is indeed your wealth. Sorry, Madam Deputy Speaker, your health is indeed your wealth. The last government frittered away that wealth, gave it to their private healthcare mates and squandered it on damaging and costly reorganisations. This new Labour government will turn the page on over a decade of Tory decay and help us live longer, healthier lives.
I now call Ian Roome to make his maiden speech.
Thank you, Madam Deputy Speaker. I've spent most of my working life in the NHS, but speaking for the first time in the House, I must start with a confession. As some of the northerly members will recognise in my voice, I was not born in the West Country. No. It is now 35 years since I was posted to then RAF Chivenor on the beautiful North Devon coast, while serving in the Royal Air Force. At the time, my flight sergeant at RAF Larbrook in Germany told me going to North Devon would probably turn out to be an adventure. I confess to the House, I do not think this place is quite what he or I had in mind. I would firstly like to thank my family, friends and all my supporters over the years. Without them, I would not be here. Especially my 2-year-old grandson, Clayton, who probably won me 1 or 2 votes. My constituency is fortunate to be famous for its stunning landscape and areas of outstanding natural beauty, its beaches, moors, farmland and forests that draw countless visitors every year. Farming and tourism sustain many of our rural communities and historic market towns like South Malton, set in rolling countryside, giving way to stunning seaside destinations like Willicombe, Instow and Braunton. Chivenor, where I was so lucky to be posted all those years ago, is now home to the Royal Marines Commando Logistics Regiment, and my area has a proud military history, now famous surfing beaches like Willicombe and Saunton Sands, were once used for training grounds to prepare Allied forces for the Normandy landings. But behind the natural beauty, the challenges my area faces are stark. Like many rural and coastal constituencies, it suffers from low wages, nearly £100 per week less than the national average, and an acute housing shortage that prices younger people out of our own communities or prevents them from starting a family in North Devon as I did. Even in the 2020s, parts of my constituency still face real deprivation. In some parts of Ilfracombe, for example, the proportion of young people attaining level 4 qualifications is barely above 25%, while life expectancy is 10 years lower than other parts of Devon. Out of uniform, I joined the NHS, starting out as a mental health nurse at North Devon District Hospital, the most remotest acute hospital in mainland England, visiting patients across unique communities like Coombe Martin and Linton, and eventually leading the campaign to build a chemotherapy and day treatment unit. My area suffers from shortfalls in important medical services like pharmacists, nursing and particularly dentistry. Our hospital now has intensive care units and operating theatres that are approaching 50 years old and desperately need of investment from the new hospital programme. However, I have also been astonished by the possibilities on offer in my constituency. Numerous coastal seats across the southwest, mine included, stand to benefit massively from investment in floating offshore wind in the Celtic Sea. With clean energy, an extended supply chain and high-paying jobs, this is potentially a shot in the arm to the economy of the Great Southwest. I would like to pay tribute to my predecessor, Selene Saxby. She was absolutely right when she identified this as a massive opportunity that, if done right, could benefit the region for decades to come. North Devon District Hospital will also soon be home to a £1.4 million clinical research centre that will lead groundbreaking studies into heart conditions, joint problems and osteoarthritis. Few people know that Barnstable, where I live, is also home to Accord Healthcare, a pharmaceutical group that manufactures a staggering 10% of all the medication used in the NHS, a vital part of this country's critical supply chain. They have just announced a groundbreaking newly orally administered medication hot off the press this week for prostate cancer, something that may benefit as many as 40,000 cancer sufferers, and a medication that is among the very first of its kind. Another remarkable firm, SEA, has just won a £135 million contract to supply cutting-edge defensive countermeasure systems to the Royal Navy. Thanks to their hard work and some innovative engineering on an industrial estate in my constituency, young people will be kept safe as they serve their country in uniform. Madam Deputy Speaker, my constituency is one of hidden opportunities around every corner. We must seize them. It is immediate privilege to me to be North Devon's voice in this place, and I intend to do it justice. Thank you.
Andrew Lewin.
Thank you, Madam Deputy Speaker, and it's a privilege to follow that very powerful maiden speech. I'm certain you will do your constituents proud, as you did in your time serving in our armed forces. I welcome this debate. After 14 years of Conservative government, our health service is in a critical condition. And in my constituency, it takes just about 10 minutes to drive from the centre of Hatfield to Welwyn East. But the difference in life expectancy is now 10 years.
Shame.
Responsibility for the crisis sits not with our wonderful healthcare professionals, but squarely with the last Conservative government. I've spent as much time as I can with our NHS heroes, and I recently saw the professionalism of our paramedics firsthand after joining a shift with Daisy and Jake in the East of England ambulance service. They were a credit to their badge, and I'm pleased to say that I got through blue lights okay. But look, GPs are battling a backlog. In my constituency of Welwyn Hatfield, more than 2,000 people waiting more than a month for a local appointment. Dentists are withdrawing from the NHS, including in Pear Tree Ward in Welwyn Garden City, in my constituency. And the most vulnerable are invariably the most seriously impacted. As the Darcy report made clear, people experiencing homelessness attend A&E 4 times as often as the general population and are 8 times more likely to need inpatient care, all immense costs to them and to the overall NHS budget. We will only rescue our health service if we reform primary care, and that's why today's debate is so important. Despite rising demand, there were 5% fewer nurses working in the community in September 2023 than there were in September 2009. And the NHS Confederation is clear. Spending in primary and community settings has a superior return on investment when compared with acute hospital services. Darcy was clear. It makes sense, therefore, that there should be a fundamental strategic shift to the community. Innovative work is out there. Again, in my constituency, I've seen the hospital at home service run by the East and North Herts NHS Trust that serves people. It's particularly powerful for those who are over 80, who need rehabilitation and care, but actually hospital is not the best place for them. Their homes are. So when the Shadow Minister said earlier she wasn't expecting to hear some new ideas, they are out there, but it's the job of our government to embrace them and to take it forward. I have every confidence that this Labour government will do that. From the party that founded the National Health Service, one that has a clear vision for the future, from analogue to digital, from hospital to communities, and from sickness to prevention.
Smeddy.
Deputy Speaker, I'm deeply grateful to the committed NHS staff who deliver exceptional care under hugely difficult circumstances. Health is, of course, devolved to Welsh Government, but on both sides of the borders, people will recognise the same struggle to see their GP increase in waiting list and A&E service in dire state. The waiting list for hospital treatment in Wales reached a record high this year, and NHS dentistry is non-existent in many parts of Wales. In my own constituency of Ynys Môn, Valley Dental will soon become the 4th dental practice to withdraw NHS service since late 2022. Between January and December 2023, only 44.8% of people in Wales receive treatment through an NHS dentist, and in North Wales it's 36.6%. Despite this, the Secretary of State for Wales has hailed Welsh NHS dentistry as a model of success. Following a long campaign by Plaid Cymru, the North Wales Medical School recently opened its doors at Bangor University, despite previous claims by the Welsh Labour government that there was no case for the school. I hope the government will now be receptive of our new campaign for a dentistry school at the university, which would secure high-quality jobs for North Wales and provide more dentists for an area beset by shortage. At the Labour Party conference, the Secretary of State for Wales announced that patients from Wales could receive NHS treatment in England and vice versa, under UK and Welsh Government plan to reduce waiting lists. And yet the Welsh Government Cabinet Secretary for Health and Social Care categorically ruled out giving patients the option to travel to England for more treatment. My party obtained freedom of information responses from 3 NHS health bodies, 2 in England and 1 in Wales. All 3 say they have received no correspondence from the UK or Welsh Government regarding the proposal. Perhaps the Secretary of State could explain to the House what the plan means for the patients in Wales. Madam Deputy Speaker, 14 years of underinvestment and the creeping advance of privatisation has placed a heavy burden on our NHS. Pursuing the same tired route will not deliver thriving and improved health services that we all want to see for staff and patients.
Natasha Irons.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, of all of our public services, our NHS is the one that unites us the most. It's in the room that our children are born in, where our parents get old, and when we receive the worst possible news. It is there for us no matter who we are, no matter what we do, and no matter what we earn. Our NHS belongs to us all. So when the previous government inherited an NHS that was working, with the highest satisfaction levels and lowest waiting times in its history, it demonstrates their utter contempt for not just this precious institution, but also for the people it serves, when we look at the state of the NHS today. An NHS where 2.8 million people struggle to contact a GP every month. But there can be no greater example of failure from the previous government than the declining health of our young people. Last year, the number of under 18-year-olds on waiting lists for paediatric care in England soared to a record over 400,000. And our children, as reported in Lord Darcy's report, are some of the sickest in Europe, with the highest rates of obesity, diabetes, poor oral health and mental health. Under the previous government's watch, 40% of children no longer have regular access to a dentist. Under their watch, the number of children waiting over 52 weeks for community health services hit 94% in just 2 years. And under their watch, 1 in 5 children are now estimated to have a mental health problem without being able to access the right treatment. Madam Deputy Speaker, from head to toe, the previous government failed our children. And this is reflected in the experience of young people in my constituency of Croydon East, where young people and their families are waiting months and sometimes even years for support. Parents are desperate for help, young people are desperate for healthcare, and everyone is desperate for hope. But, Madam Deputy Speaker, Labour has fixed our NHS before, and under this government we will fix it again. Yeah. Following Lord Darcy's report, the Prime Minister has already recognised the need to change our health service and has already set out this government's intention for a 10-year plan to change our NHS. Our Health Secretary has already committed to putting in the extra resources we desperately need for primary care, including £82 million of investment to recruit 1,000 newly qualified GPs, and to finally reform the broken dental contract to get more dentists into the communities that need them. So, Madam Deputy Speaker, unlike the previous government, we will fight for our NHS. We will not allow primary care services to continue to be overwhelmed. We will not leave patients rotting on waiting lists. And we will not let our children be the sickest in Europe. We will fix our NHS. We have fixed it before, and we will fix it again.
I now call Martin Wrigley to make his maiden speech.
Thank you, Madam Deputy Speaker. I'd like to congratulate my honourable, or is it gallant, friend from North Devon on his maiden speech. I would like to start by thanking my long-suffering family, especially my children, Zoe, Sam and Emily, who have been truly supportive throughout everything to get me to this place. And I'd like to express my thanks to the amazing team in the constituency who worked so hard to get me here as well. It's an honour to have been elected and to represent my constituency of Newton Abbot, an area that I've called home for some 25 years. I tend to find people in Westminster either ask, where is Newton Abbot? Or they say they know it well through personal experience. We're on the south coast of Devon, between Exeter and Torbay, between the sea and the gateway to Dartmoor, with the rivers Tean and Exe. The constituency name reflects our largest market town. It could add Dawlish, Teignmouth, Kingstainton, let alone the many villages, Starcross, Kenton, Bishopstainton, Abbots Kerswell, Hogwell, Denbury, Ipplepen, Broadhempston, and many, many more. I've been wondering what to tell this place about my constituency. Perhaps the creative and innovative people, including Newton Abbot's own Ollie Watkins, the members of Muse, or Peter Cross, usually seen at England rugby fixtures, with his resplendent Cross of St George hat and coat. Or the history of Brunel's engineering of the coastal railway. Or today's mining of ball clay. Or previously the granite used to rebuild London Bridge, the British Museum and others, quarried from Dartmoor and transported via the Temple Way, tramway itself created from granite, all shipped via the port of Teignmouth. Or the story of Dawlish violets, Jane Austen's visits, Keats's poem, or how Dawlish became the home of black swans. Maybe the protected shores of the ex-estuarian Dawlish Warren, home to many thousands of wildfowl and wading birds each winter. Suffice to say, the area is steeped in history, fame and natural beauty. You will find much more than Devon cream teas and scones, but of course with the cream and jam the right way up. Growing up in a Royal Navy family, we moved around an awful lot, and moving to Dawlish was a natural choice. But I suspect it was also my parents' influence that caused me to set my sights on this place. In the 1950s, they met in Downing Street, when my mother worked in Churchill's office. My father told us stories of racing to the parking place outside number 10 in his old MG. And speaking of previous politicians, I pay tribute to my predecessor, Anne-Marie Morris, and her dedication to the constituency. Her maiden speech spoke of the waves gently breaking over the trains on the Dawlish seawall. The 2014 storm, however, showed us that the force of the sea and the increased storms due to climate change was both serious and urgent. Since then, Network Rail have constructed new seawall and rebuilt the station and more. However, it was the catastrophic cliff collapse near Teignmouth that caused the longest interruption of rail services, cutting London off from the southwest peninsula, and we are still waiting for funds to be confirmed for that work. Climate change is a real and present threat to us on the coast, and we cannot stop it with just flood defences and mitigations. We must do everything we can to reduce the use of fossil fuels and CO2 emissions. Yeah. Turning to healthcare, Devon has both an ageing population and fewer hospital beds per head of population than the national average. Local hospitals are falling into disrepair and are often overlooked in the model of care. It was during my first week in this place that I heard from the local NHS Trust. It was cancelling the planned new Teignmouth Health and Wellbeing Centre that would have replaced the crumbling hospital. Due to increased costs and a recent cap placed on their capital budget, bizarrely because of revenue overspend, the project was cancelled. The new centre was to become the home to local GPs and local NHS services. I did write to my pen pal, the Secretary of State, on the issue, but have yet to hear back. In the meantime, I'm working with the GPs to help them secure a new home and avoid putting primary care for 18,000 patients in jeopardy. Teignmouth Hospital is still under threat of closure, despite housing many NHS and voluntary sector services. Meeting recently with Volunteering in Health at the hospital with my right honourable colleague from Kingston and Surbiton, we saw how their model of wraparound care had been copied internationally and that Singapore was now rolling that out as global best practice. As an engineer and a Liberal, I know that we do not need to accept broken systems. We can fix them. And by empowering people, we can build a brighter and better future. I will do everything I can in this place to fix systems and help my constituents, help protect the beautiful constituency, the environment and its biodiversity as long as I am here. Thank you.
Yeah. Dave Robertson.
Thank you, Madam Deputy Speaker. Can I congratulate the previous speaker for his excellent maiden speech. I am sure he will be a fierce advocate for the people of Newton Abbot and the surrounding area over the coming years, and I look forward to working with him for the next few years. I'm very glad to be able to speak in this debate because it is a very important debate on primary care. It is an issue that affects all of our constituencies, but was absolutely the number one issue that came up on the doorstep during the election campaign across Lichfield, Burntwood and the villages in my constituency. And we are effectively here to discuss the centralism and poor decision-making that typify the last decade and a half of incompetence by the party opposite on primary care. Yeah. There can be fewer more obvious examples of this than the fate of Burntwood Health and Wellbeing Centre in my constituency. The building was home to a GP surgery serving almost 5,000 residents of the town, and the contract for this surgery expired in March last year. There was no replacement facility ready for that date, and so the surgery couldn't move, which meant it had to close. The building itself is still in use by the ICB, and the practice was happy to seek an extension, but it was not allowed by NHS England. The result of this is that more than 1 in 8 of the people of the town have had to be redistributed to other surgeries because a process in London didn't allow organisations in Staffordshire to deliver the best solution for my constituents. It's centralist, it's wrong, it was wrong then, it's wrong now, and it does need to change. Even worse still is that the proposed replacement facility, originally scheduled for completion in October last year, is still nowhere near ready. We're expecting planning permission sometime early in 2025, and who knows when it will actually be completed. This is such an important issue for my constituents in Burntwood, Madam Deputy Speaker, as we all know the potential knock-on effects that delays in accessing primary care can cause. The staff at the remaining surgeries are doing all they can to support the community, but at some point, increased patient rolls like this cannot be mitigated. It's one example of the challenges that people face in seeing a GP. It's not the only one in my constituency and very far from the only one across the whole country. It cannot be fixed overnight. 14 years of it going wrong will take longer than 14 weeks to fix. I applaud the Health Secretary, though, for going so far as he has so quickly, cutting red tape to allow 1,000 new GPs to be taken up, commissioning the Darcy Review into the NHS so that this party, the one which created the NHS, can ensure that we build a health service which is fit for the 21st century. I'll end there. Thank you very much.
With thanks to the previous speaker for not using all of his time to make his maiden speech, Tom Gordon.
Thank you, Madam Deputy Speaker. I'd just like to first start by congratulating my Liberal Democrat colleagues on fantastic maiden speeches, which have given me a lot to live up to. Whilst in the order of thanks, I did a cardinal sin at my election count. I reeled off my Oscars Award-style speech, reminding everyone who, over the last 30 years of my life, had played a part, and importantly forgot to acknowledge my agent, the worst thing any political candidate or MP could do, and I've not yet lived that one down. Whilst we're on the topic of thank yous and acknowledgements as well, I would like to thank the Tory predecessor, Andrew Jones, for his hard work as a valued constituency MP. Many people said that throughout the election campaign, and his work getting the bathing water status for the River Nid. Now, looking at my constituency, it might seem a little bit too obvious. There are two principal towns, Harrogate and Knaresborough, and Knaresborough doesn't like coming second, and for a good cause and reason too. It's a older town, an ancient market town with a fantastic castle and the Nid Gorge and the view over the River Nid. It's got a strong sense of community, and I encourage anyone who hasn't heard of the Knaresborough bed race to Google it after this. It's truly a unique event. And on Harrogate, an old, famous spa town. It's been reviled for its healing waters that have drawn people from all corners of the globe, including the Russian aristocracy and royal family previously, and people like Agatha Christie, who turned up there after a nationwide manhunt trying to find her. It's a place of intrigue. But in more recent years, it's become a place of culture, a cultural gem in the north. We've got the fantastic Harrogate International Festivals, which have a range of the calendar across the year, from literature to arts and everything in between. We've also got RHS Harlow Carr, and we're a flower town where we've won lots of awards at both regional and international Bloom festivals. We've also got Harrogate Convention Centre. Now, a little while ago, before I was born, apparently Eurovision was hosted there, and one of the most frequent things that comes up is that I should launch a campaign to get Eurovision back. But that relies upon getting millions of pounds of investment into Harrogate Convention Centre, something I've been campaigning on already. And for a little-known fact, probably to people on the opposite benches, is that we will have something that almost rivals Eurovision March next year, when we have Lib Dem Spring Conference and Glee Club will be in town. As well as Harrogate and Knaresborough, we have a wide range of villages too. But what interests me is the people, and the people are what make our area so fantastic. It's that Yorkshire grit, determination and resilience that really makes our area shine. So I'll give you a few potted bits of pieces of history about some famous and some more infamous folk from my part of the world. We've got Mother Shipton, who was Knaresborough's answer to Nostradamus, made a bit of a pariah and cast into a cave and was called a witch. To this day is a fantastic and one of the biggest tourist attractions in the area. We also, on the more infamous part, play host to the childhood home of no friend of this place, Guy Fawkes. The less said about him, probably the better. Furthermore, we've got more modern and contemporary people too, like the Lionesses Rachel Daly and Ollie Alexander as well. One person who does stick out as a person in the history books is Blind Jack, who is said to be the founder of modern road building, and he built kilometres upon kilometres or miles and miles of turnpikes back in years and centuries gone by. And rumour has it North Yorkshire Council might get round to repairing them sometime soon. But it's the people that do make it great. And now, reflecting on the topic of today's debate and access to primary health care, I think the reason to me that health is so important is in those moments of desperation and worry and anxiety, when we reach out and go to that front line of primary health care, when we see our GPs, when we're truly human. You know, I think when I look back at some of the more formative moments of my life and my experience, it's those times when I've gone to a GP that my life has been changed. I think one of the things that to me has been quite pertinent about today and giving my maiden speech today, is we're in Breast Cancer Awareness Month. And there's been lots of fantastic bright pink outfits of people wearing pink to highlight that cause. The reason I got involved in politics was because the day before I started my master's degree in public health, my mum was diagnosed with breast cancer. Fortunately, she's recovered and fine now, and I've even made her a councillor in Wakefield for the Liberal Democrats. She's not yet forgiven me for that. But the point is that when we were going through that experience, I dropped down and did my degree over 2 years to look after her and my little sister, who was just 5 at the time. And what we know is that getting access to health is most important in getting a good outcome. Fortunately, in our case, my mum was fine, but the complications of having gone through lots of surgery and chemotherapy still live with her today. And I know myself as someone who lives with a chronic condition, was earlier this year diagnosed with ulcerative colitis. Actually getting through that door to the GP can be the biggest barrier to getting a diagnosis and that treatment and support. But reflecting back on the people, I wouldn't be here without them. So it's an honour and a privilege to be here elected to represent the people of Harrogate and Aylesbury, and I shall do my best, whether it be on health, culture and tourism, or what other wonderful fortunes and opportunities await me.
Alice MacDonald.
May I congratulate the member opposite for his cultured and moving speech and without notes, which is always very impressive. I'm pleased to have the opportunity to speak in this debate today. I come from a family rich with GPs, primary caregivers who are the bedrock of our NHS. My granddad, my aunt and uncle, and my cousin, who is a qualified GP too. But over the generations they have served, times have got harder and pressures have grown. Under successive Conservative governments, we saw decades of underinvestment, mismanagement, and a lack of long-term planning, which has left primary care on its knees. Indeed, during the election campaign, we had to fight to save our NHS walk-in centre. I'm glad to say that we succeeded, which has become such a source for so many people in my constituency. But, as the Health Secretary said when he visited Lionwood Medical Practice in Norwich North, the cavalry is coming, and in fact, it has arrived. We know that the task is monumental, but as the party that created the NHS, we know how to fix it. Madam Deputy Speaker, I welcome our 10-year plan, which has primary care at its heart, making sure that we shift from hospital to community and from sickness to prevention. Of course, we know that because of the black hole in funding that we have been left by the Conservatives, money is tight, but we have already taken action, investing £82 million to recruit 1,000 newly qualified GPs. But of course, primary care refers also to dentistry. And in my county of Norfolk, we have been allowed to become a dental desert, or as the Secretary of State has said, the Sahara of dental deserts. A recent ONS dentistry report states that 99.7% of new patients in the East cannot access NHS dental care. That is totally shocking and unacceptable. Absolutely. I want to also note that many pregnant women are unable to access the NHS dentistry care that they are, of course, entitled to for free. In fact, brand new data from the British Dental Association and Women's Institute shows nearly 1.5 million NHS dental appointments have been lost for pregnant women and new mums since the start of the COVID pandemic. So can I ask the Minister to really focus on what we can do to improve women's access to dental care? Dentistry is a feminist issue too. So I welcome our plans to rescue NHS dentistry, and I'll also continue pushing with colleagues across Norfolk, and I can see the member for North Norfolk over there, for the dental school that we so desperately need. So let me finish again with the Health Secretary's own words. The cavalry is coming. We will fix the NHS and make sure it is fit for purpose. Thank you very much.
Dr. Al Pinkerton.
Thank you very much. For my constituents in Surrey Heath, access to primary care, whether GPs, dentists, pharmacies, or indeed optometrists, has become an increasing postcode lottery. Vast dentistry deserts, maybe not of Saharan scale, have opened up across Surrey Heath, with residents simply unable to find an NHS dentist with an open list for themselves or their families. When a list does open up, it almost immediately closes again due to the overwhelming demand. Today, families are being forced to seek private provision for their dental care if they're able to stretch their finances that far, or they simply forgo dental care altogether. During the recent election, I even met a constituent who'd resorted to an amateur tooth extraction because of the lack of local, affordable dental treatment. The postcode lottery extends to GP services too, although the issue of access takes on a slightly different form. While Surrey Heath has some excellent and much-loved GP practices, who are really working hard to put the experiences of users first, there are others whose booking systems, triage mechanisms and approach to communication leave patients feeling anxious and frustrated. I would like to pay particular tribute to the surgery in Lightwater, a village in my constituency. Residents regale me routinely with stories about the fast, efficient and friendly telephone service they provide, the availability of on-the-day appointments and the generally high quality of the service they provide. It's little wonder that residents from miles beyond Lightwater are so desperate to move their registration to that particular well-run surgery. Some other surgeries, however, are not quite so highly praised, criticised for their impersonal online booking systems and inappropriately long waiting times for appointments, sometimes requiring patients to wait a month or so to see GPs. This isn't just poor practice, it has real-life implications for health outcomes for patients and for the economy, as residents take longer to be seen, longer to be treated, longer to recover, and longer to get back to work than if they had been seen earlier. Online booking systems risk creating a digital barrier to entry for our most vulnerable residents. It cannot be right that those requiring healthcare might be dissuaded from seeking it because of the complexity of approaching your GP, or because you don't have, can't afford, or can't operate the technologies required to book an appointment. Our local pharmacies too are under huge strain, and I commend the incredible local independent pharmacies who look after communities across Surrey Heath so well. I'm incredibly pleased that we're having this debate today, not only to talk about the challenges of primary healthcare, but also to highlight some of the great practice that we can see within our communities. We need to support our local pharmacies who deliver so much care and support, and we need, as the Liberal Democrat manifesto proposed, to enshrine the commitment that patients can see a GP within 7 days, a commitment underpinned by an associated commitment to train, recruit thousands of GPs every year. Thank you.
Dr. Becky Cooper.
Thank you, Madam Deputy Speaker. The Darcy Review has effectively shone a spotlight on the key issues that GPs and all in the healthcare profession have experienced over the past 14 years. It rightly highlights the detrimental impact of austerity and the increased pressure that the pandemic put on an already stressed service. It also draws attention to the ongoing excellent work that is being done by NHS staff across the country in spite of, rather than because of, the facilities, systems and processes that are not fit for purpose and must now undergo intelligent reform. Primary care is an essential part of our health system. It is where prevention meets treatment, and GPs can effectively undertake secondary prevention to keep people well for longer. For example, people with chronic conditions such as diabetes and hypertension. So as a public health consultant, I want to fight for our GPs and make sure that they have the resources that they need. So I want to highlight 3 things today. I often speak to the Royal College of GPs, and we are in sync with these 3 things that I would like to raise. Firstly, the long-term workforce plan. It is due for review next year. It has been underfunded in previous times, and we have to look at the modelling that is in the workforce plan now. If we are moving from a hospital to a community model, we have to look at the rate of increase that we expect in our GP service. It currently stands at 4% for GPs and 49% for hospital consultants. That is in no way detrimental to my colleagues who are hospital consultants. They are incredibly important, but we need to review this workforce plan. And I know that the Public Accounts Committee were looking at this prior to the election, and as a new member of the Health Select Committee, I will encourage that work to continue. Secondly, we were talking earlier, Madam Deputy Speaker, about a mixed model of GP provision and how that will work. In my own constituency of Worthing West, the Worthing Integrated Care Centre is due to open very soon. It is a neighbourhood model where GPs will work with other healthcare professionals to provide a holistic wraparound service. But as has already been demonstrated in this chamber today, there are already partner practices that are working effectively. So it's the interaction between neighbourhood hubs and those partner practices. In the terms of pragmatic politics, we need to get those to work and work well for our GP colleagues. And finally, we have talked, Madam Deputy Speaker, about the National Retention Strategy. GPs are leaving currently in their droves, and even though we have many people coming forward for GP trainees, it has been said in this chamber that we must make sure that we retain our GP colleagues. This is particularly acute in deprived areas. As a public health consultant, health inequalities are one of the major issues in this country. And in order to address that, in order to make sure that prevention is writ large for those areas of health inequality, we must make sure that we are retaining our GP colleagues in these areas. Many thanks.
Manuela Pertigella.
Thank you, Madam Deputy Speaker. I rise today to speak on a primary care issue that is deeply affecting my constituents in Stratford-on-Avon, access to NHS dentistry. Many of our communities in Stratford-on-Avon are facing what can only be described as dental deserts. Over the past years, we have seen more dentists leaving NHS services, and residents are left with limited options. In some cases, my constituents are waiting months for an appointment, forced to travel significant distance to see an NHS dentist, or worse, being told that they must pay privately or go without. Some have resorted to emergency care, and some have attempted even DIY interventions. The lack of access to NHS dental appointments can have serious health implications in the long term. For example, dentists can detect conditions such as oral cancer and diabetes, osteoporosis during routine appointments. We have heard across the country that 4.4 million children are not seeing an NHS dentist in the past year, and this is shameful. In our own area, the situation is worsening, with more NHS dentists opting out of the system because the current dental contract is unsustainable. It's not surprised that patients are being removed from NHS lists, exacerbating the crisis. In recent research, based on a series of national polls, Health Watch reported that disabled people and those with long-term health conditions were more likely to avoid going to the dentist because of the costs. The Liberal Democrats' dental rescue package proposes investing in additional dental appointments, reforming the broken NHS dental contract, and ensuring that everyone in need of urgent or emergency care can access an NHS dentist in their locality. And we should give our constituents the right to register with their local NHS dentist. I therefore urge the government to act now before this crisis deepens even further. Thank you.
Danny Beales.
Thank you, Madam Deputy Speaker. The fundamental promise of our NHS is that it's there for all of us whenever we need it, no matter how much we earn, where we live, who we are, or what part of the health system we need to access. Unfortunately, after 14 years of the party opposite, that promise has been broken. And particularly it was disheartening to not hear any contrition, any reflection from the party opposite when the shadow spokesperson made her comments earlier today. Despite the hard work of NHS staff, waiting lists at record highs and patient satisfaction at record lows, the NHS is near breaking point. We all knew this going into the election. We heard this from our constituents. I certainly did from mine in Uxbridge and South Ruislip. Yet even so, the findings of the Darcy review were still incredibly shocking. Primary care, as has been said by the members opposite, is the front door to our NHS, and that front door is increasingly slammed shut in the face of our constituents. And the effects of this are being felt. 50 years of progress on cardiovascular disease is in reverse. Progress on cancer outcomes has stalled, and cancer survival rates in the UK are falling behind other comparable countries. There is a lot to do, and it will take time to do it. But I am assured by the comments of the Minister in her opening remarks that this government is taking this matter incredibly seriously. I welcome the Secretary of State's focus on 3 critical shifts needed to modernise our health service, and particularly primary care. From analogue to digital, from hospital to community, and from sickness to prevention. These shifts will not only improve value for money for our health service, but ensure everyone in our communities lives longer, healthier lives. We've heard today the importance of the GP, and particularly the family GP. We've got GPs seeing more patients than ever before, and yet the number of qualified GPs relative to population is falling. This strain will only be exacerbated as populations grow and age, and I welcome the government's commitment to GP recruitment, with 82 million being invested in 1,000 more GPs. I must also stress that I know the spokesperson mentioned the capital investment pressures on the government, and we certainly do want to see capital investment in hospitals, including Hillingdon Hospital in my constituency. But primary care capital investment is also needed to unleash potential capacity. We've heard from members opposite and members on these benches about dental deserts and the need to improve access to dentistry. And I welcome the commitment of this government to engage with the British Dental Association, one of the first meetings I know that the Secretary of State held, and I look forward to the outcomes of these discussions. Furthermore, and lastly, I want to focus on community pharmacy, and I've met representatives of local and national pharmacy groups in the first few weeks in this role. Pharmacy is incredibly well placed to take the pressure off GP services. Pharmacists are trained, they're professional, and they're ready to go, and I welcome the government's plan to create community pharmacist prescribing services to utilise the skills of pharmacists. I'll end as I started. There is a lot to do, but we've done this before, and we must do it again, rebuilding and reforming our NHS so it's there when we all need it. Thank you.
Yeah.
Luke Taylor.
Thank you, Madam Deputy Speaker. And I'd like to take the opportunity to begin my speech by agreeing some general agreement about the state of the NHS. It was a Liberal idea, delivered by the Labour Party and then broken by the Conservatives. And we can see from their attendance in the debate here today how much interest they have in trying to fix it. We will act as that responsible and constructive opposition to work with the government to fix the many problems we see in the NHS. I said, no, I won't, thank you. Solving the crisis in access to primary care matters not just for patients facing traumatic situations, but for our GP surgeries themselves, who are striving to do their best under the most difficult of circumstances. Our hard-working GPs dedicate years to train and work hard at what they do because they are passionate about being there for their patients. For too long they've been let down, and it is our job now to give them the means to continue doing their remarkable jobs. We know the difficulties. Too often appointments are not available, and patients and staff experience frustration and conflicting priorities in attempting to access services. For patients, this often means resorting to dialing 111 or even 999 and attending A&E when issues escalate. This puts further pressure on our already overstretched NHS emergency facilities, which too often have to deal with issues that could have been fixed by preventative primary care if patients could access it in a timely way. GPs in Sutton and Cheam are telling me that due to the level of demand, requests for appointments are triaged and decisions have to be made to prioritise patients with increasingly complex needs, often with very little information available. Unsurprisingly, this is affecting their mental health and also making it increasingly difficult to retain experienced staff, further eroding the ability of practices to keep up with demand. The ask from GPs in my constituency is simple. The Minister must quickly act to increase their budgets and offer certainty that will allow them to financially plan ahead after a sustained period of real-term cuts in funding. This will allow them to hire and retain more staff at competitive wages in this cost of living crisis, lower the collective workload and treat more patients more effectively. It is not enough to simply offer more training places or incentives to train if surgeries cannot employ the GPs who are already qualified and available, as is a particular problem in my constituency. If our GPs cannot compete with the private sector on pay or with overseas governments who attract our doctors with improved conditions, a lower workload and even possibly better weather conditions, their legend has it there are places that have even more sun than Bournemouth, apparently. We cannot hope to retain GPs in the NHS. We must make it easier for foreign students who have studied and qualified in the UK to get right to remain after their course should they wish to do so. As this new government searches for ways to boost growth, I say that this is here in front of them. There is no better investment in our future growth than good quality primary healthcare, keeping patients healthy, able to provide for themselves and their families, and live healthy and fulfilling lives. Thank you.
Jen Craft.
Madam Deputy Speaker. I'd just like to begin by just reflecting on the member opposite. His version of history regarding the founding of the NHS is something that I'm not myself familiar with, so thank you for that history lesson. The state of our GP services is nowhere felt more keenly perhaps than in Thurrock, where we have the highest number of patients to GPs in the country. At a coffee afternoon in my constituency a few weeks ago in Aylesbury, where the local medical practice has perhaps the highest patient load of our entire area, we were discussing some of the issues facing the community and also some of the solutions. And I think that might be a little bit of the this debate in microcosm, so some reflections on that. People feel that they deserve to see a GP, and there is a bit of common sense from my constituents, particularly in Aveley, around what they can expect after 14 years of Conservative government running their healthcare services into the ground. They know that they don't always need to see a GP. They know that sometimes a face-to-face appointment isn't necessary. However, what they need to know is that the healthcare they need is there when they need it. And that GPs that were at the meeting had a similar reflection that they want to be able to spend the time that they have allocated to their patients, not in form filling, not in running around bureaucracy, not in referring back to secondary providers. They want to spend their time delivering the best medical care possible. In Thurrock, we have a great example of community healthcare in our local community hospital, Orsett Hospital. What it does very well in terms of blood tests, dialysis. People can get the care they need on the doorstep. This hospital has been under threat of closure for as long as I can remember in my lifetime. I was born there, and since then the services have been taken out of it one by one. We have a healthy scepticism in Thurrock, I would say, for neighbourhood health hubs. We've been promised them for a number of years, and thanks to a combination of the Conservative government incompetence and the Conservative council incompetence locally, we no longer had the money to provide them. And in my constituency, out of 3 healthcare hubs promised, all we have to show for it so far is a hole in the ground in one of the most economically deprived areas, which is Tilbury. Madam Deputy Speaker, I said some of what came out of that discussion was also some solutions, and I think we need a buy-in from our population if we are to turn around primary healthcare. People need to know what services are available, and they need to be in charge of their healthcare. They need to be in charge of their healthcare prevention. They need to know what is coming up on the horizon for them and how they can take steps to change outcomes for themselves. So I'd like to conclude by welcoming this Labour government's approach to turning around the NHS towards a preventative and a community model.
Yay. I call Liz Jarvis.
Thank you, Madam Deputy Speaker, and I'm so pleased that we're having this very important debate this afternoon. Like my colleague, the Honourable Member for Stratford-on-Avon, I'd like to highlight the issues of dentistry in Eastleigh. Eastleigh is facing an acute NHS dental crisis, with many of my constituents unable to access basic dental care. By the end of 2023, over 48% of children in Hampshire had not been seen by an NHS dentist in the previous 2 years. According to the NHS website, only a third of dentists in my constituency are taking on new NHS patients. I've heard from residents who are desperately trying to find an NHS dentist, but after calling surgery after surgery, cannot find one taking on new NHS patients. 62% of adults in Hampshire have not been seen by an NHS dentist in the past 2 years. That leaves them with very limited choices, faced with going without any treatment at all, try to find the money to pay for private treatment, or resort to DIY dentistry. One resident told me that their NHS dental appointment was cancelled at very short notice with no alternative offered because their dentist, a highly skilled dentist from Poland, left after Brexit, and now there is no NHS dentist available at his local practice. Another constituent told me how his dental practice is struggling to keep appointments and now only has one NHS dentist who is available, and that's on Saturdays only. Patients are being asked to sign forms agreeing to private treatment at NHS prices without the protections they would usually receive under NHS care. The previous government pushed NHS dentistry to the brink of collapse. So I hope that now the new government will reverse this trend by increasing investment into dentistry, using unspent funds to increase the number of NHS dental appointments and removing VAT on children's toothbrushes and toothpaste to make oral health more affordable. As a local NHS dentist told me, the dental contract isn't fit for purpose. His colleagues are leaving the NHS in droves. My constituents in Eastleigh would benefit from an emergency rescue plan for NHS dentistry. Proper investment to tackle this crisis would offer more NHS dental appointments and deliver free check-ups for children. This is the kind of direct action we need to prevent more children from suffering and to ensure that everyone, regardless of their income, can access high-quality dental care.
Alex McIntyre.
Thank you, Madam Deputy Speaker, and may I congratulate the members opposite on their wonderful maiden speeches. Madam Deputy Speaker, the challenges facing primary care services in our country were set out in damning detail in Lord Darcy's report after 14 years of Conservative mismanagement. And I wish to thank the Secretary of State for bringing forward that report so quickly to this House and getting on with the job of making our NHS fit for the future. Knocking on doors in Gloucester, my constituency, access to a GP and getting an NHS dentist appointment remain one of the biggest challenges facing my constituents. And I recently held a cross-party meeting with councillors in Tuffley and Grange wards in my constituency about the challenges the residents there are facing getting a GP appointment. I know particularly we have issues with accessing dentists with over 2,500 patients per dentist. That's despite the fact that frontline workers in our NHS are working harder than ever, but retention in our workforce is a key issue. And may I ask that the government looks at family-friendly policies to make sure that we are retaining as many frontline key workers as we can. Now, I was surprised to hear the Shadow Minister talk about prevention in her speech earlier, given that 14 years of Conservative health policy, the only thing they seem to have prevented was my constituents getting access to the health care that they needed. But prevention is important to this government strategy for health, because it's better for patients, it gets them easier access to the care they need and better health outcomes, and it's better for the taxpayer as it's far cheaper than by going to the hospital when it's far too late. And I'm pleased to see that this government is already taking action, but we've got to get this right. There's a principle in the NHS of getting it right the first time. And I'm really pleased to see and hear that the Secretary of State and his team are taking time to listen to our health service in putting forward our 10-year plan to get the NHS back on its feet and fit for the future. Because our NHS may have been broken by the party opposite, but it is not beaten. And it's always in debt to the frontline staff, who I'm sure all of us owe a personal debt of gratitude. And I welcome the plan to tackle red tape in primary care and make sure that we are focusing on patient care and delivering the best care for our patients. I welcome the fact that we have already recruited 1,000 newly qualified, or working towards recruiting 1,000 newly qualified GPs. We're bringing back the family doctor. We're bringing in 700,000 more urgent dentist appointments. We will fix the mess that we inherited from the Conservative Party, but it's important to my constituents that we get it right the first time, and that is what this government is getting on with the job of doing.
Yeah. I call Sarah Gibson.
Thank you, Madam Deputy Speaker. I will cut to the chase. The state of NHS primary health care in my constituency is depressing. I have 3 local issues that I would like the Minister's help with. The NHS dental care provision in the light of the largest Hathaway dental practice being forced to close its doors to NHS patients on the 1st of November. A stalling of a proposed medical centre in Cairn over 4 years due to delays by the ICB, and the decision to refuse a licence for a new pharmacy in Caution. However, today, given the shortage of time, I'm just going to concentrate on one of them, which is the urgent fact that we have a closure of a dentist surgery in my constituency. As everyone here is aware, dental services are broken. People are pulling out their own teeth and being rushed to the NHS in order to deal with a problem that is everywhere. But integrated care boards across the country are underspending millions on dentistry. Chippenham comes under the Bath and North East Somerset, Swindon and Wiltshire ICB. And according to a Freedom of Information request by to the British Dental Association, this ICB dentistry underspend amounts to 4.2 million. I mention that because there are several colleagues in the room with the same ICB. My constituents are horrified by this. We are about to lose yet another NHS dental practice on the 1st of November, in part due to recruitment challenges, but mostly because of this dental contract system. In my first weeks as an elected member for Chippenham, I attended a briefing on preventative health care with the Secretary of State, and I felt reassured that this was an issue being looked at. However, 3 months have passed,
and I have seen nothing concrete from the government about a reform of these contracts or even a proposed consultation timeline. I would implore the health team on the opposite side to urgently review the NHS dental contract system and stop the dental health care from being a privilege. The ICB repeatedly say they'll come back to me. Practice owner tells me that they cannot get it to work. Truthfully, I'm at a loss. The government, along with the CQC and my local ICB, say that they're doing something, but nothing seems to happen. Madam Deputy Speaker, I implore the government to work with those of us in the Liberal Democrat benches who want the best for our NHS. We agree we need a more preventative approach. So much is broken, we need to put it to right together now before it's too late.
Yeah. Dr. Peter Prinsley.
Madam Deputy Speaker, thank you. First, as the Right Honourable Shadow Secretary of State reminded me last week, I must declare that I am a surgeon, so I have an interest in this matter, but so do we all. The last government should be truly ashamed of itself. I see but one remaining member, a colleague of mine, sitting opposite. General practice has been badly neglected. The public could see this. Surely the government must have known this. Certainly the patients could see this. The scramble on the phone at 8 o'clock, hoping not to be at the end of the queue for one of the very few appointments with one of the very few doctors. During my career, I've seen the number of hospital doctors and consultants increase many times, but we've seen very little increase in GP numbers, and now we live with the consequences. Too many exhausted GPs, many leaving the profession altogether or retiring much too soon. And now, the spectre of the two-tier GP system, as private GP services expand rapidly all over the place. But we can do better than this. We will do better than this. We're already doing better, with plans to recruit many qualified GPs without jobs into practices without doctors. So I speak today because we must look after our GPs as never before. We will move much of our care out of our hospitals into the community, but it is on the GPs that we depend to achieve this. We will see GP services expanding to provide community investigations, facilities and specialist and surgical services, much more, as we rightly adopt the new government's agenda of moving the care out of the hospitals. We must make sure the GPs have the very best IT, the best technology. We must connect the GP IT with the hospital IT so that I can see the same record as the GP, and the nonsense of typed letters and fax machines should end completely. But I am optimistic. Scientific advances continue to astonish us. We know what we have to do, and we have the determination to do it. The doctors and the patients will support this. Let's get to work. GP is the best of the NHS, and we must support it.
I call Edward Morello.
Madam Deputy Speaker, in my constituency of West Dorset, as across the country, community pharmacies are being asked to deliver more and more primary care services, increasingly acting as an alternative to GP surgeries. They are delivering vital health care services such as health consultations and vaccinations. However, the funding model for community pharmacies is outdated, insufficient, and does not reflect the expanded role they now play in our healthcare system. Community Pharmacy England reports that a sixth of pharmacies could close within a year, and the National Pharmacy Association estimates that the average pharmacy will lose £43,000 this year. This is being played out writ large in my constituency. Lyme Regis has already lost its last remaining high street pharmacy. Our Beminster and Sherborne pharmacies are reporting six-figure annual losses due to the unsustainability of the funding framework. A funding model that, as the Pharmaceutical Services Negotiating Committee suggests, does not account for the higher operating costs in rural areas, as well as wild fluctuations in medicine prices that can result in pharmacies losing money on every prescription issued of certain drugs. They also have to operate within a system whereby they only get compensated for consultations that lead to prescriptions being issued. This leads to a perverse focus on patients where a medicalised outcome is most likely. I urge the government to re-evaluate the funding model for community pharmacies. We need a system that recognises and rewards the broader role that pharmacies now play, particularly in rural areas. Pharmacies are delivering critical health services, and yet they are being financially penalised because the funding system is still based on an outdated model. If we continue on this path, we risk losing these vital community assets. Pharmacies in rural places like West Dorset cannot survive on the current funding framework. They are the lifeline for many of my constituents, and without immediate action, we could see further closures, which would leave vulnerable populations without access to vital healthcare services.
Chris Webb.
Thank you, Madam Deputy Speaker. In my constituency of Blackpool South, life expectancy is the lowest in the country for both men and women, around 10 years below the average in England. Lord Darcy's recent report pointed out that people who live in the most deprived areas of England are twice as likely to wait for more than a year for non-urgent treatment. These problems are compounded by poor quality housing, low income and insecure employment, which are particularly pronounced in my constituency. This is evident in the casework that I receive in my constituency office. One man whose son got in touch with me recently has been waiting years for a simple hernia operation. This has impacted his mental health and has led to his son fearing his father could take his own life. Physical health inequalities contribute to poor mental health and the crisis surrounding it. Chris Whitty's 2021 report on health in coastal communities detailed the alarming rates of diagnosed severe mental illness in Blackpool. There were over 500 hospital admissions for intentional self-harm in 2018-19, and suicide rates among men were the second highest in the country. 3,000 people have a severe mental health issue in my hometown. I recently had the opportunity to meet with staff and patients at the Harbour in Blackpool. This modern mental health hospital has fantastic facilities, but the 154-bed facility is hugely oversubscribed and patients are routinely sent hundreds of miles away to receive hospital treatment, putting undue pressure and stress on their families. The lack of mental health beds has a knock-on effect on Blackpool's Victoria Hospital. A 60-person facility at A&E has held up to 188 patients at one time waiting 50 hours to be seen. These waiting times have been normalised, but they can mean the difference between life and death. And hospital admissions for children with mental health problems in my constituency are around 60% higher than the national average. I would urge the Minister and the Secretary of State to look at modern uses of mental health support championed by charities in my constituency, one being Counselling in the Community, an award-winning mental health charity. Led by the incredible founder and CEO Stuart Hutton-Brown, it uses the skills of trainee counsellors, giving them valuable career experience whilst acting as a lifeline for its service users. Empowering charities like this to expand their work rather than relying on the private sector to plug the gap in the NHS is a great model that will enable us to put money back into the community rather than the pockets of private providers and offers better value for money. These problems are instilled in Blackpool and I'm encouraged by the government's recognition of this. And I know the Minister's Department are prepared to face up to the scale of these challenges. Sadly in Blackpool though, they're all too apparent.
I call John Milton.
Speaker, the ongoing crisis in GP access is as acute in my constituency of Horsham as it is elsewhere. That's not simply because there are more patients, it's also because today's patients have significantly greater health challenges and need to see their GP more frequently. This is why simple comparisons with GP ratios from the past don't work. We need a health service capable of meeting today's needs, not those of 20 years ago. In Horsham, it's become routine for surgeries to fill all available appointments within minutes of opening. Relatively junior staff are then obliged to spend the rest of their day saying no to frustrated, anxious, and not infrequently angry patients. The danger is that we might enter into a spiral of decline whereby demoralised staff leave, piling more pressure onto those who remain and scaring off replacements before they've ever had a chance to settle. We've got to get working conditions right, and that can't be achieved in a state of permanent understaffing. But we also need to get more from the services we already have. Unleashing market forces onto the NHS and setting pharmacies, GPs and hospitals against each other was a mistake. Effectively, they're in commercial competition to provide more of the treatments that pay well and less of the ones that don't. Only the integrated care boards are in a position to take a holistic view of patient provision, but that's not really happening yet. Madam Deputy Speaker, there are any number of alarming statistics relating to our health service, but I'd like to conclude on one that's a bit more positive. As mentioned by one of my colleagues earlier, studies by the University of Cambridge and others suggest that where patients are seen by the same GP over 15 years, then the average mortality rate declines by 25%. That's a remarkable level of improvement, more than I think you could expect from almost any other intervention. Let's give GPs the space to do their job properly and support this motion. Thank you.
Calder Morris.
Thank you, Madam Deputy Speaker. I want to speak about some of the challenges that I experience. I'm out in my constituency, whether it was before the election or since. Whether I'm out in Throckley, in the western reaches of Newcastle, or in Otterburn, Bellingham or Wark in the Tyne Valley, the inability to get a decent GP appointment is one that is continuously raised with me. It's one of the greatest frustrations and one of the greatest appreciations by constituents of the sheer scale of the task that this government has inherited. One of the things that I want to gently ask of the health team on the front bench is that when we look at building the community health service that we so desperately need, that we consider that for 14 years our rural communities in particular suffered from those health services being hollowed out. And if you are forced to go on public transport and it takes hours to get between small towns and villages, then the barrier to a GP appointment becomes all the bigger. It's something that was communicated to me throughout the election in visits to wards that I don't think Labour canvassers had knocked in before, but which was coming back as one of the prime reasons to switching to the Labour Party from many residents of Hexham, and the reason that I'm stood here as Hexham's first ever Labour MP. Ultimately, also in my constituency, 5 out of the 7 dentists are not accepting new patients, and this is a crisis that's particularly acute in the western part of Newcastle and Calder and Throckley. It's been raised with me multiple times on the doorstep, and it's been illustrated by many of the contributions from across the House, the devastating impact that this has upon families, upon people's mental health as well as their physical health, and the absolute disgrace of people getting visibly emotional talking about their struggle to secure a dentist appointment in 21st century Britain is one of the many, many, many badges of shame that the Conservative Party should wear as they consider their future choice. And I note the empty spaces on the benches opposite. But ultimately, I want to pay tribute to the GPs and to the frontline staff who work tirelessly to deliver the healthcare across my constituency and further afield. But just to emphasise that for particularly rural areas, that the challenge facing the NHS has never been greater. It has been brought to its knees by 14 years of mismanagement, 14 years of complacency, and we now need to rise to the challenge. I'm confident that this health team, this government will do that. Thank you.
Sarah Dyke.
Thank you, Madam Deputy Speaker. We know that primary care has been struggling to meet targets, keep up with demand and help the population remain healthy. This is particularly acute in rural areas like Glastonbury and Somerton, as primary care faces specific issues such as recruitment, retention and access to services. Madam Deputy Speaker, GPs serve a crucial and multifaceted role in healthcare, but all too often they are inaccessible in rural areas. Last year in Somerset, 21% of GP appointments took more than 2 weeks between booking and an appointment, higher than the England average wait. In fact, 7% of appointments took well over a month. GPs play a crucial role in serving people's mental health, as well as their physical health. The EFRA Select Committee's 2023 report on rural mental health concluded that the NHS mental health services are not fairly accessible for rural communities. A one-size-all doesn't fit everyone, and appropriate services should be developed to serve rural communities. To help mend the mess left by the Conservatives, the Lib Dems want to give everyone the right to see a GP within 7 days or within 24 hours if they urgently need to, with 8,000 more GPs to deliver on it. Rural communities also suffer with poor access to public transport, which means it's more difficult to access services, and poor rural broadband means it's hard to access those online services. It's clear that a cross-departmental work is needed to access the challenges rural people face in accessing mental health support. I believe these hurdles must be factored into the national strategies focused on addressing mental health. Madam Deputy Speaker, we must look at how pharmacists can ease the pressure on GP services, but they too need urgent support. Now, between April 2015 and June 2024, there was a net loss of 1,200 community pharmacies, consisting of 1,402 closures and only 179 openings. The rate of pharmacy closures in Glastonbury and Somerton is shockingly near double the national average. Community pharmacies provide an essential high street service in rural market towns, and many have now simply gone. The Liberal Democrats are clear that we need a fairer and more sustainable long-term funding model for pharmacies, and we must build on the pharmacy first approach to give patients more accessible routine services and ease the pressure on our GPs. The new government has spoken out about our crumbling public services, but now is the time to act. My constituents cannot wait.
Steph Ackwarden.
Madam Deputy Speaker, countless times during the campaign I discussed issues about primary care with people in North Norfolk on the doorstep, and the damning legacy of the last Conservative government means that almost everyone in my area has their own story. Stories of people who are waiting 4 weeks to see their GP, about anything non-urgent, of people whose oral health has declined so much they are no longer able to smile, of people who are worried for the supplies of vital medicines. The primary care crisis is acutely felt in North Norfolk, and I'm glad that it is the Liberal Democrats who will be pushing this government to bring forward solutions. Madam Deputy Speaker, residents in Blakeney are set to lose their rural branch surgery at the start of next month, despite overwhelming efforts to save it. Many people who live in Blakeney rely on this surgery and have based their independent living plans around it. Surgeries are key community assets, and people will genuinely suffer if they are lost, and it's why I've been proud to support our call for a small surgeries fund to give financial stability to surgeries like the one in Blakeney, and I hope the Minister today can tell us if the government will be supporting this. Madam Deputy Speaker, one of the biggest issues for North Norfolk also is the dentist crisis. The member for North Norwich herself reminded us of his description of Norfolk being the Sahara of dental deserts. And I've been pleased with the progress we're making working with the ICB in the months since my election, safeguarding dental services in Holt and Wells, and pushing forward the case for a new dentistry school at the University of East Anglia. And I've enjoyed working with my colleague, the member for Norwich North, on that. This matters to people like my constituent, Alan. He receives no state support, despite his wife being unable to work. And when they needed urgent dental treatment, he was forced to dip into his small savings. It cannot be right that when someone pays into the system for all of his life, it simply isn't there when he needs it. These problems have deeper-rooted issues. Mental health services don't have the networks to really reach people in rural areas. Our small surgeries are vital because of our lack of public transport infrastructure. Our GPs struggle to find new partners because of ballooning property prices. And our pharmacies and hospitals can't attract the specialists they need because there isn't the housing. The solutions to these problems in primary care require an holistic approach, and I hope the government is taking steps to stop these problems being siloed. Madam Deputy Speaker, all Liberal Democrat MPs are champions for our left-behind local health services, and I urge the House to support this motion today and show that we mean business about bringing our primary care services like those in North Norfolk back from the brink.
Yeah. Dr. Danny Chambers.
Thank you, Madam Speaker. Everyone on both sides of the House have sort of eloquently spoken about the difficulty their constituents are finding and accessing primary care. And as the Lib Dem mental health spokesperson, I'd like to focus on some potential initiatives that will help solve these problems. There's a really good initiative in Winchester that recognises that there are many socio-economic problems that contribute to poor mental health. And if you look at the poorest 20% of people, they are twice as likely than people on the on average salaries to experience mental health issues. And so there's a fantastic initiative in Winchester where the local NHS mental health services are working with the Winchester Citizens Advice to help people in mental health with mental health issues deal with things like debt, things with monetary issues, housing issues, and it means that they end up spending a huge amount less of NHS resources. The latest the analysis that they did showed that for every £1 spent on this initiative, that there was about £14.06 on cost avoidance, as in people less likely to have to then engage with mental health services again. I'd be really keen if the mental health team would be willing to meet with me and the team in Winchester who've come up with this initiative, because it really could be rolled out over the rest of the country. And while we talk about community mental health, we've often talked about community mental health hubs. That's something the Liberal Democrats have been calling for a long time, so that we can engage with people proactively who are at risk of having mental health issues. And we know what those demographics are. You know, when we're doing physical health screenings, you target it towards demographics that are likely to suffer from those diseases. And it's the same with mental health. You know, we know military veterans, we know that farmers, we know that women 1 year after giving birth, we know that the LGBT plus community and other demographics are at a higher risk of experiencing mental health issues, and we could be engaging with these people much more proactively through community mental health hubs to ensure that they don't end up then needing to go and access primary health care. And the final thing, Madam Deputy Speaker, is to just acknowledge, although it is secondary care, the long waiting lists from when you go to your GP and you're referred for a mental health treatment. They're huge. They could be months, they could be over a year. And that in that time, people can end up going to A&E. And that takes a lot of time and resources. It costs the taxpayer a lot of money. And GPs in Winchester tell me they spend a huge amount of their time dealing with people already on waiting lists for referral, and they're coming back again needing help in the meantime. So that would really help free up primary care. Thank you.
Ian Solon.
Thank you, Madam Deputy Speaker, and thank you to everyone contributing to today's debate. There's been a lot of excellent contributions. In my first contribution in this House, in the Lord Darcy investigation debate last week, I raised the challenge of delivering primary care under a funding model that has failed to take account of the growth in Cambridgeshire. And I'm going to reiterate that, because I will take every opportunity to iterate it, because it's a gross injustice in Cambridgeshire, and I note that other members have noted it in their own areas of growth. And beyond that sort of unfair funding model, I'd also urge the government to provide mechanisms to pump prime those areas of growth, so new services can be commissioned ahead of time to really help deliver those services as people move in, much like we see with other services like schools. My honourable friend, the member for Horsham, mentioned a Cambridge University study and the benefits to patients that showed from continuity of care. And I think this is a real focus, as also the new chair of the Select Committee, that should be brought by the government to ensure better outcomes for patients. But also that study showed that when patients see the same doctor, they don't need to see that doctor as frequently over the course of their treatment. And so it's a win-win. We're not just seeing benefits for patients, we're seeing benefits for NHS services and ultimately benefits to us all. Particularly, again, that Cambridge study showed that those benefits are felt most with older patients. And that's why the Lib Dems have been campaigning for everyone over the age of 70 to have that access to a named GP. So in terms of how we go about getting that continuity of care, I really would urge the government to set an ambitious target, like the Lib Dems have, to drive that strategy forward of getting continuity of care, improving outcomes for patients and improving outcomes and productivity for the NHS. Thank you.
Chris Gocklin.
NHS dental contract is so flawed that it punishes dentists for overperforming. So they cannot meet patient demand even if they are ready and willing to do so. And during the election campaign in my constituency in Dorking and Hawley, I was struck by how many dentists contacted me to tell me that the system was broken. One dentist took me for a coffee in Dorking. She told me that she had quit as an NHS dentist because the sums simply didn't add up. It was costing her more to treat NHS patients than she was receiving under the NHS contract, and that is why so many dentists are leaving the NHS contract. And as we've heard from so many honourable members today, the consequences for children in particular are devastating because they end up in A&E. Just last week, a constituent contacted me to tell me that they had been unable to afford private dental care for broken teeth, so they had accessed a cheaper teledentistry company. The result was a botched job with them having permanent ligament and bone damage. This crisis will only end when we reverse the previous government's cuts to dental care, because everyone should be able to access affordable, high-quality dental care. The Liberal Democrats have a plan to fix our dental deserts, and so I urge members to support this motion. Thank you.
Joshua Reynolds.
Thank you, Madam Speaker. In my constituency of Maidenhead, the proposed GP Health Hub in Reform Road has been cancelled. The land owned by the local council, of which I'm a member, as declared in my register of interests, but the council's ready to sell the land that's needed. But after a long wait, Frimley ICB have scrapped their plans because of rising costs and interest rates. This leaves a significant gap in our healthcare infrastructure. With thousands of new homes planned and being built, we need the GP facilities to match. But with the ICB pulling out, it's Maidenhead residents who will suffer. Residents in Binfield in my constituency have no better luck getting a GP appointment, with local GP surgery saying, don't bother trying to do the 8 a.m. ring. You're not going to get an appointment. Don't even try it. St Mark's Hospital in my constituency is a cornerstone of our local community. 25 years ago, it was the local Liberal Democrats that battled to bring the urgent care centre to St Mark's in Maidenhead. But at the beginning of the pandemic, the walk-in was closed on what we were told was a temporary basis. To date, it's yet to reopen. And no matter how much we've tried, we've been told the system is good enough without it. Now, I'm a local lad from my constituency, and when I was at primary school, I fell over and hurt myself. My mum hobbled me to St Mark's. Within an hour, they'd done an X-ray. They put me in a cast and they've sent me off on my way home in crutches. Compare that to the situation now, where residents tell me time and time again they're struggling to get the care they need when they need it. Grandchildren who've had a bang on the head turn up at St Mark's to be told to go to Wexham Park in Slough, where they have a 15-hour wait at A&E. Or children who cut their finger open and instead of being able to take a 5-minute trip up the road, have to endure a 60-minute rush hour drive to Slough. Walk-in urgent care centres are really beneficial for our local communities because they allow us to take the pressure off A&E, off the major hospitals, and have this care done locally. It's not a difficult concept. Allowing people to get the care they need, to see their GP, to see their pharmacists, to use the walk-in centre at St Mark's, will mean fewer people in accident emergency, saving hospital admissions, freeing up beds for those who need them, and importantly, saving the NHS money. It's the Liberal Democrats and our hard-working local champions that will always be there for the NHS and championing primary care. We're committed to reversing the decline in GP numbers, ensuring that all of our communities have access to the primary care they need when they need it. The challenges are significant, Madam Deputy Speaker, but they're not insurmountable, because with the right policies and the right funding, we can turn the tide on this and we can get people the care they need. Thank you.
Caroline Verdon.
Thank you, Madam Deputy Speaker.
Speaker. I feel like we're playing a game of top trumps here in who has the worst dental services, but
I do.
Thanks. The services in South Devon have been so badly neglected by the Conservative government that we live in one of the worst dental deserts in the UK. NHS dentists in Totnes, Dartmouth, Brixham, Paignton and South Brent have closed, leaving thousands of my constituents, many suffering severe dental pain, with no choice but to pay extortionate private dentists for help. One of my constituents said, "My daughter is 18, a student at college, and I am on ESA. We lost our NHS dentist in Totnes 2 years ago. We took the decision to go on a basic payment plan that gives one check-up and a hygienist visit, as I have gum disease. We can't afford this. On a visit to the dentist today, we were hit with a £160 bill for a small filling that my daughter will need. I had to pay £80 up front, and this is our food money for the next 2 weeks gone. And it'll be the same again when she returns for her appointment in October. We will have to use the food banks to eat this month." Another told me her daughter has a regular infection in her wisdom teeth which requires constant antibiotic treatment, and she has been told it will cost £5,000 to remove them, or she'll have to wait 2 more years for NHS treatment. The state of dentistry in South Devon is absolutely shocking. There are currently no dentists taking on new NHS patients, not one, in a constituency of over 300 square miles. And I think it's shameful that there aren't more people on the benches beside me to hear this. Yeah. People in Devon and Cornwall are waiting 1,441 days on average just to register with a dentist. That is 4 years. The new government has talked about the benefits and importance of preventative health care, and nowhere is this more clear than in dentistry. It's not just about filling cavities and giving you a nice smile. We know that there are links between gum disease and cancer. A poor oral microbiome can increase the risk of stomach and colorectal cancer. And we also know that visits to the dentist as a child increase the chance of a lifetime of good oral hygiene. Liberal Democrat research has shown that in the past 5 years, over 100,000 children have been admitted to hospital with tooth decay. And this is absolutely not what our hospitals need after 14 years of neglect from the Conservatives and a system that is completely overwhelmed. The government must immediately renegotiate the NHS dental contract, and I asked the Minister whether he has considered raising the UDA to stabilise dental practices immediately before more of them go under. They must guarantee appointments for all those who need a dental check before commencing cancer treatment or chemotherapy, and they must support preventive dental health care. Preventative care will always be less costly than the extensive treatment required later in life if people don't get into good habits at a young age. Thank you.
I also make some brief comments about dentistry. I'd just like to say that some of the members on the benches opposite seemed genuinely confused about our claims that the Liberals had anything to do with the founding of the NHS, and I would urge them to Google the Beveridge report. My grandfather was a dentist, so as a child I was privileged enough to have access to dental care as and when I needed it. Although when I was 8, I did fall down the stairs at his surgery and break my arm while he was doing my dad's fillings, so possibly his health and safety wasn't as good as his dentistry. However, many children nowadays do not have the same access to dentistry that I did as a child. In the last year in Somerset, the percentage of children seen by dentists was just 42%, when the English average is over 55%, and the percentage of adults seen in the last 2 years was still only 32%. The Darcy review revealed that only about 30 to 40% of NHS dental practices are accepting new children and adult registrations, and this is leaving many with no option but to go private. My constituency of Roome in East Somerset is also considered a dental desert and is also predominantly rural, which means access to services is even more limited. The lack of public transport means that accessing dental services is difficult already, and with practices not taking on new patients, they are pushed even further afield. I've had an email from 2 constituents from Roome earlier this month. They've been unable to see an NHS dentist for 4 years due to lack of availability for new patients. As they themselves said in their email, it not only affects our oral health, but contributes to broader health issues that can arise from neglecting dental care, and they're anxious about potential long-term impacts. Getting a dentist appointment should never be as hard as it is now, and I would urge support for our motion to help reduce dental deserts and rescue NHS dentistry from disaster.
Ollie Glover.
Thank you, Madam Deputy Speaker, and I congratulate my honourable friend, the member for North Shropshire, for introducing this debate. I echo my honourable friend's call on the government to boost access to GPs, NHS dentists and community pharmacists. In my constituency in Oxfordshire, the growing number of people moving into the area has not been matched by an increase in GP, dentist or pharmacy services. Indeed, frustration with the terrible Conservative track record on these health issues is a major factor in my election to this place in July. On Great Western Park in Didcot, on which more than 5,000 people now live, there lies a site ready to be developed into a GP surgery, and there is money from the developers to build it. However, the local NHS body responsible for building and providing the doctors, nurses and other support staff, sadly, has struggled to marshal the resources to do it. I call on the government to prioritise supporting NHS bodies and providing the mechanisms for bringing forward primary healthcare. Meanwhile, many people in my constituency, particularly in Didcot, often cannot see a GP without the rush for the early morning telephone that my colleagues have articulately summarised and hoping to get one of the precious slots. The GP surgery at which I'm registered in Didcot, it's even a challenge to get an online appointment with a 2-minute window granted once a week to try and fill in an e-consult form, a process that generally defeats me for non-urgent matters. As my colleagues have said, dentists in my constituency are telling me that the funding they receive for their NHS patients is barely enough to break even, and it's no wonder that whether in Wallingford, Grove, Wantage or Didcot, private dentistry is what dominates in my constituency. As my honourable friend, the member for Winchester, has articulated, mental health services are also under strain, particularly for CAMS, a child and adolescent mental health service. All of these need better support. So I therefore call on the government to take action and recognise what Lord Darcy said in his report, that improving access to primary health care will have a significant impact in relieving pressure on A&E and indeed the need for cancer treatment by enabling earlier diagnosis and therefore proactive intervention.
Freddie Van Mirela.
Thank you, Madam Deputy Speaker. I very much welcome this debate today. GPs are rightfully pillars of our community. Doctors remain one of the most trusted professions, perhaps unlike our good selves. But I'd also like to mention some of the other key professions within the primary care sector, including practice nurses who dedicate their lives to working on behalf of our residents and who are right now working hard to deliver flu jabs, COVID jabs, RSV jabs and shingles jabs to many of our residents. They are the unsung heroes that keep primary care going. But there are declining numbers of them due to wage constriction. New nurses looking to boost their salaries often opt for hospital-based care because the unsocial hour payments can mean they can improve their pay packet. Mental health nurses, healthcare assistants, social prescribers all also provide essential services. And we can't forget receptionists. Receptionists bear much of the public's frustration after 14 years of failed governments and have my thanks for their role. GPs are, however, in crisis. The Tories let waiting times soar and failed to deliver a new framework contract for GPs in time, leading to industrial action. I'm very concerned in my area that we have sleepwalked into a two-tier health system with long waits for those who can't afford private care and access for those who can. We are seeing in Henley the first fully private GP practices and many people going for jobs with corporate insurance plans. There are now routinely 4-week waits in places like Tame, Benson, Watlington and Charlegrove, where we've seen significant housing growth. As my honourable friend for Didcot and Wantage spoke of, developer funds have been collected, but again in Oxfordshire aren't being released in time to deliver the infrastructure needed. I want to particularly highlight the impact of these waits on some of the most vulnerable people. Recently, I spoke with a constituent called Susanna Windborough, a tenacious campaigner with learning difficulties, who highlighted to me just how important timely access to healthcare is for her, and the collective impact of a lack of access means that people with learning disabilities die earlier than those without one, 23 years earlier for men and 27 for women. I welcome, therefore, very much the Liberal Democrat commitments made on health and encourage the party opposite to copy our manifesto. Honestly, we won't mind, including our commitment to GP seeing a GP within 7 days or 24 hours if urgent, 8,000 more GPs, and having a named GP if you are over 70. I'd like to also highlight our very important policy on delivering mental health professionals in schools, which I hope the party opposite will also copy.
I call Claire Young.
Deputy Speaker, given the time constraints, I will skip some of the examples like Thornbury Health Centre and Three Shires Medical Practice, which are already safely lodged in the Secretary of State's inbox. Instead, I want to focus on the interdependence within the primary care system. It's very much an ecosystem in which strains in one part have knock-on effects in others. And to illustrate that with an example from my Thornbury and Yate constituency. This summer, I met a community pharmacist in Abbotswood, an area with significant health inequalities. He raised the same concerns about the flawed funding formula for pharmacies that we've already heard about today, but he has an additional challenge. The next-door GP surgery, with which his pharmacy has had a symbiotic relationship for many years, has been incorporated into a larger group. The other surgeries are in another urban area, some miles away, and difficult to access by public transport. And this local surgery now only offers patients limited hours. Understandably, many of them are switching to surgeries in central Yate. And that not only has an impact on the viability of that local GP surgery, but also on the pharmacy, who is missing out on the pharmacy first referrals that he might have expected to get. And also, understandably, people, once they have travelled into town, will generally use the pharmacies there too. And if that pharmacy is unable to continue, people will miss out on the valuable preventative work that it does. Monitoring medications, providing services for people who've got diabetes, for example, vaccinations. It provides very many important preventative services. And that will increase pressures on GPs and on our hospitals. And he was also commenting on the impacts of the dental desert that we have here in my area, as in others around the country, that people cannot get access to NHS dentistry, and that leads to health problems and leads to other health issues not being picked up. So what I want to stress is that you cannot just fix one part of the system. You have to look at the system as a whole, and that's what the Liberal Democrats recognised in our manifesto, in the election campaign, and I would urge the government to look at our plan for the NHS and work constructively with us to fix all aspects of primary care. Thank you.
Gideon Amos.
Thank you, Madam Deputy Speaker. I mainly want to talk about dentistry, but first I'd like to support the comments of my honourable friend, the member for Glastonbury and Somerton, because GPs in my Taunton and Wellington constituency are leaving at an alarming rate, and it's a problem across Somerset and something that is great concern. Somerset, if we've heard about Sahara deserts, if Norfolk is the Eastern Sahara, I think Somerset and Devon are the Western Sahara when it comes to dental deserts. Over half the children in Somerset did not have access to a NHS dentist last year, which puts Somerset in the worst hit 5% of local authority areas in the country. And for adults, it's a pretty similar picture. I set up a survey back in 2022 to raise attention to the lack of dentistry in Taunton and Wellington, and official NHS figures have now shown that the majority, 56%, the majority used to have access to an NHS dentist. It was 56% in 2015, gone right down to only 32% this year. And as has already been said, 99% of people who need an NHS dentist cannot get one. It's a totally unacceptable situation. And it's a primary care time bomb, because we already heard that for children under 6, the biggest cause of their admittance to hospital is for tooth decay, but also oral cancers are on the increase, on the rise, year on year on year. And without the early detection that dentists do, that will only get worse. Just like the social contract in which people felt they would get care is broken, so is the dental contract itself broken. And I really urge the government in their summing up to say something about how soon they will repair the dental contract, when they will increase the UDA so that that contract is working, because we need a timescale for that to be addressed. My constituent, Madam Deputy Speaker, Catherine, had been with her NHS dentist for 20 years. That dentist withdrew from NHS treatment, and she lost that treatment like so many other people. But unlike many other people, Madam Deputy Speaker, Catherine is undergoing treatment for secondary breast cancer, the side effects of which means that her doctor has instructed her to have regular dental treatment. She is now using her hard-earned savings to pay for that dental treatment because it is not possible to get dental treatment on the NHS in Somerset. Madam Deputy Speaker, how disgraceful is it that cancer sufferers are using their hard-earned savings to cover over and repair the damage of the legacy left by the last government of appalling NHS and appalling dental services? It's totally unacceptable.
I call Max Wilkinson.
Thank you, Madam Deputy Speaker. There were references to history earlier on, and I would contend that that debate about the origins of the NHS is akin to two bald men fighting over a comb, given how far in the history it is. And I'm allowed to make that joke, and so are you, Minister. Sorry, and so is the Minister. So I stand today to place on record the shocking state that the last government left Cheltenham's NHS in. But I will start by saying thank you to the nearly 3,000 people in Cheltenham who have signed my petition to ensure that Cheltenham gets the GP surgery it needs as our town grows. GP waiting times in Cheltenham are variable, but they are often far too long. This is not because GPs are not working hard. One I spoke to recently told me that they were seeing dozens of patients per day, and of course when it gets that intense, that is beyond the level that most humans can cope with the processing of information. That is a safety issue. We owe a great debt of thanks to our GPs. Others have mentioned the dentistry desert. I research regularly on the internet. There are no dental practices I could find that were taking new NHS patients in Cheltenham. That is regularly the case. The Honourable Member for Gloucester opposite is shaking his head because many of my residents end up going to Gloucester on the odd occasion. That is when they are lucky enough to find a place for one of their children, because most of the time there are no spaces for adults. Regularly, people in Cheltenham are referred as far away as Worcestershire for new dentistry. That is shocking. But this all creates tension in A&E, as we've heard. In 2013, Cheltenham's A&E department was downgraded to an overnight nurse-led service. In May 2015, when the previous government started governing alone, 684 people waited more than 4 hours to be seen at Cheltenham and Gloucester's A&E departments. In May 2024, when the general election was called, that number had ballooned to 5,668 people waiting more than the target time. That is absolutely shocking. The increased pressure has been caused by people's inability to get, in many cases, that dentistry, but also GP appointments. Now, local campaign group REACH formed to oppose that downgrade. My two predecessors fought the downgrade, and their best efforts, I'm afraid, have not yet borne fruit. I will join them, but it is now acknowledged that by most people in Cheltenham that our A&E department is possibly never going to be reinstated with 24/7 doctor-led care. The current setup puts pressure on GPs and A&E and our hard-working doctors, and it cannot be allowed to continue. In the spirit of constructive opposition, we will work with the government on solving these problems. Thank you.
Lee Dillon.
Thank you, Madam Deputy Speaker, for calling me in this important debate. In West Berkshire, last year we experienced a 31% increase in the 4-week wait for GP appointments compared to 2022, indicating that more patients are struggling to access medical care. And this is also compounded by us having the lowest pharmacy provision in the country, with 7,200 patients per pharmacy, compared to the national average of 4,600. Last week, I met with constituents to hear about their experiences with healthcare services at home. One constituent shared their frustration after seeing a GP only to be told that their issue fell under the remit of a pharmacist. Then the pharmacist told them it fell under the remit of the GP. This is unfortunately not a unique experience, with 24.2% of people reporting a poor experience with GPs. That is why services like West Berkshire Health Watch are so important. The current governance model for partner GP surgeries also needs addressing to help maintain their very existence. In particular, de-risking leases in strategically important estates And I hope the government will look at the General Practice Premises Policy Review of 2019 and implement the findings to ensure that leases are assigned to NHS bodies. This will help in the retention of more GPs, which will in turn improve health outcomes for patients. Now, Madam Deputy Speaker, the public was sick and tired of our failing NHS. That's why in July this year, they prescribed the Conservatives with a much-needed period of opposition. Hopefully a repeat prescription. And I hope that we can now start a treatment plan to get our NHS back to full health.
Ben Maguire.
Thank you, Madam Deputy Speaker. Congratulations to the excellent maiden speakers today, and also congratulations to the handful of Conservative members who came out to try and defend their indefensible record on the National Health Service. When it comes to NHS dentistry, constituencies like mine of North Cornwall are some of the worst affected by the dental deserts which we've heard all around the country today, left by the shocking legacy of the Conservatives. As the member for Dorking and Hawley and others mentioned earlier, we must have NHS dental contract reform now. No more delays, no more excuses. 1 in 5 dentists have left Cornwall since 2019, and the number of urgent dental cases is spiralling out of control. I'm not exaggerating when I say that I have upset, distressed parents contact me every single day about their children's rotting teeth. They can't find NHS dentists, and they're completely at a loss. Just last week, I had a panicked and anxious parent called Georgina who got in touch because her daughter Phoebe, just 10 years old, was in need of emergency dental care. She'd already missed lots of school as a result, and she needed to have a rotting tooth removed, but couldn't find an NHS dentist, and so was instead sent to Trellisk Hospital. Just a few days later, Phoebe was urgently admitted to A&E with extreme facial swelling. She was taken into surgery, where the rotten tooth was removed after much pain and distress. Her face had swollen to the size of a tennis ball, and she'd been off school now for weeks. The stress and anxiety this experience caused Phoebe, who, by the way, has complex special educational needs, her mother and the rest of the family, was completely unnecessary. If Phoebe had just been given a place with an NHS dentist, this strain on the family, and importantly the hospital that treated her, would have been avoided entirely. A teacher from Weybridge during the campaign also admitted to me that she resorted to using pliers to extract a rotten tooth, as the alternative was to get treatment as far away as Nottingham. After 100 children were admitted to hospital for tooth decay in Cornwall last year alone, this House needs to come together and ensure that the dental deserts we've heard about all day today are solved once and for all. What kind of society are we, Madam Deputy Speaker, which allows our children and people of all ages to suffer like this?
Clive Jones.
Madam Deputy Speaker, the GP is the front door of the NHS, as my right honourable friend said, and yet communities in my constituency of Wokingham, such as Arborfield Green, go without any local primary care provision. This is in an area which is growing by thousands of people, and my constituents expect to have access to GPs that are accessible and provide timely and appropriate care. But the unfortunate truth is that there simply aren't enough GPs. Now, we know where the fault lies, Madam Deputy Speaker. The Conservative Party's underfunding and poor workforce planning has led to a service in crisis, jeopardising the standard of care patients receive. GP numbers have fallen, and £350 million has been cut from GP practices in real terms since 2019. Each GP in my local ICB area now, on average, is responsible for 534 more patients than they were in 2016. And nearly 80% of GPs say that their workload is impacting patient safety. It is clear that this is not a sustainable system. But still, sadly, there is never an apology from these 5 people on this bench. I would be grateful for the Minister's view on the Royal College of General Practitioners' call for primary care infrastructure to be explicitly referenced in the National Planning Policy Framework. This, they argue, would strengthen local planning authorities in holding developers to account on social infrastructure such as GP surgeries. And so I hope the Minister will make representations to their colleagues at the Ministry of Housing, Communities and Local Government to consider the Royal College of General Practitioners' response to ensure that places like Arborfield do not lose out any longer, and to ensure that as Wokingham continues to build to government guidelines, we have an increased number of GPs to cope with all the extra patients that the new building brings.
Monica Harding. Thank you, Madam Deputy Speaker. I am proud to speak today about our NHS, which looks after my constituents in East and Walton, both young and old, and in the middle every day. But after years of neglect and failure by the previous government, my constituents in East and Walton are too often struggling to access the primary health care which we believe should be a right. The NHS was denied necessary reforms and resources. It has not been prepared for an ageing population with increasing rates of chronic and complex conditions. And now this extra strain shows up in more patients per GP and in the daily lives of my constituents suffering long waits or unable to get appointments. I recently received a letter describing how a GP appointment for a constituency's elderly mother was cancelled at short notice and how, after a month, despite several emails, had not been rescheduled. Problems like this are far from being one-off. In my constituency, residents often struggle to get same-day GP appointments, and too many wait more than a week. Our personal citizen contract with the NHS is implicit in being British, but that contract is fraying. Being able to access a GP in a timely manner is an essential expectation that my constituents still have and want, and that is why a Liberal Democrat guarantee of access for all to an appointment within 7 days, by enshrining this as a right in the NHS's constitution, is so important. It reflects the duty of the government to ensure that one's local GP is always accessible. These excessive wait times are intimately connected with the Conservative failure to recruit and to retain GPs. The previous government committed in their 2019 manifesto to recruit more than 6,000 GPs. Instead, there are fewer GPs than there were 5 years ago. During this period, however, the population has continued to rise and age, and conditions are more complex. This broken Conservative promise, yet another failure, means that in the last 8 years, the number of patients per fully qualified GP in Surrey Heartlands has risen to 2,163. This comes even as the UK has one of the lowest ratios of doctors to people, recently ranking 22nd out of 33 OECD rankings. And even when people can get an appointment, it is often not with a GP, often unknowingly. As my honourable friend for Westmoreland and Lonsdale pointed out, policies pursued by the previous government, including the restrictions of recruitment of GPs under the R's scheme, mean that in East and Walton there have been incidents of GPs being offered voluntary redundancy, even as residents struggle to get an appointment with a GP. Our most vulnerable patients have a particular need for security and stability, and this belief underpins our Lib Dem conviction that everyone over the age of 70 or with a long-term physical or mental health condition... I call the Liberal Democrat spokesperson, Jess Brown-Fuller.
Thank you, Madam Deputy Speaker. Today marks the first Liberal Democrat Opposition Day in this House for 15 years, and we have dedicated it to the topics that are fundamental to constituents up and down the country: carers, the provision of care, and the NHS. And as the Liberal Democrat spokesperson on hospitals and primary care, it is my honour to close today's debate and pay tribute to the many excellent contributions from honourable members from our benches and across the House. I particularly like to pay tribute to the honourable members for North Devon, Newton Abbot and Harrogate and Knaresborough for their passionate tributes to their constituencies in their maiden speeches today. And I'd also like to pay tribute, I'm very grateful to the members such as the member for Worthing West, for Bury St Edmunds and Stowmarket and for Hinckley and Bosworth, who bring such valuable knowledge to the Chamber during debates on healthcare. Our NHS, Madam Deputy Speaker, was once the envy of the world. The care, compassion and accessibility it offered were unparalleled. And sadly, after years of Conservative mismanagement, our NHS and care sector are in crisis. Every day, thousands of patients face agonisingly long waits, often in terrible pain, while trying to see a GP or get an appointment with a dentist. Lord Darcy's report highlights that primary care services are heavily underfunded, which in turn is leading to unnecessary hospital admissions. There are clear economic benefits to investing more in primary care, and with the first budget of this new government due to come to this House soon, I would remind the Chancellor that for every £1 spent in primary care, it is estimated to save 10 in urgent and secondary care. Exactly. In my constituency of Chichester, people are deeply worried about accessing GPs, a concern echoed throughout the general election campaign and reflected in my surgery appointments with residents. The public's trust in the NHS is eroded due to the consequences of poor Conservative management. And as the member for Easham and Walton pointed out, the Conservative government promised 6,000 more GPs in 2019, but instead GP numbers have fallen by almost 500. GP practice funding has been cut by £350 million in real terms since 2019. Healthcare is not a luxury, it is a necessity. As Liberal Democrats, we believe everyone should have a legal right to see a GP within 7 days or within 24 hours if it's urgent. So we would pledge to recruit 8,000 more GPs to deliver on this promise. And we also want those over 70 and those with long-term conditions to have access to a named GP, ensuring continuity of care, which helps prevent unnecessary hospital admissions. And as the chair of the Health and Social Care Select Committee mentioned in her contributions, continuity of care is vital for patient trust and staff morale. This is not the first time I have mentioned this in the Chamber to the Secretary of State, but the collapse of a not-for-profit GP federation serving Chichester and the South Coast last month was a stark reminder of the system's fragility. Patients' appointments were cancelled, services threatened, and 130 staff were left unpaid. The collapse was due to the erosion of contract values with primary care networks and NHS Sussex. When GPs are sitting in my surgery telling me they want to work but they can't, with no reassurance that they will be paid for the work that they have done, something has gone terribly wrong. And dental care is another critical area within primary care. We've heard today about dental deserts across the country, and I began this afternoon's debate trying to list every member that contributed their dental desert to this afternoon's debate, and I gave up. But what I can tell you is that it was shocking to hear the statistics and some harrowing case studies from across the House. So the Liberal Democrats are calling for a dental rescue package, which includes investment in more dental appointments, reforming the broken NHS dental contract, and using flexible commissioning to meet patient needs. Workforce planning for health and social care must also be written into law, ensuring we have enough dentists to meet demand. And lastly, we must reverse the cuts to public health grants made by the Conservatives to support preventative dental care, including oral health programmes and promoting healthy eating choices, which will reduce the pressure on our NHS dental services. Madam Deputy Speaker, the government have an opportunity to turn around a decade of Conservative chaos and mismanagement of our precious NHS and give primary care the attention and focus it deserves, and we will work constructively with them to make sure that patients in Chichester and across the country get the care that they deserve.
I call Minister Stephen Kinnock. Thank you very much, Madam Deputy Speaker. This really has been a vibrant and powerful debate. And I'd like to thank the Liberal Democrats for using their opposition day constructively and to shine a searing spotlight on the challenges that our constituents face. Now, honourable members made a series of outstanding contributions, but I would in particular like to thank my honourable friends, the members for Aylesbury, Bury North, Calder Valley, Ealing Southall, Welwyn Hatfield, Croydon East, Lichfield, Norwich North, Worthing West, Uxbridge and South Ruislip, Thurrock, Gloucester, Bury St Edmunds and Stowmarket, Blackpool South and Hexham, for demonstrating why our party always has been and always will be the champion of the NHS. Yeah. I'd also like to congratulate the honourable members for North Devon, Newton Abbot and Harrogate and Knaresborough for their excellent maiden speeches. Yeah. But I do have to say, Madam Deputy Speaker, that really is quite shocking to note that in spite of the vital importance of this debate to our constituents, there was not a single contribution from the Conservative backbenches. Not only do they refuse to apologise for the last 14 years, they've run for the hills. Their silence truly does speak volumes. Madam Deputy Speaker, we on these benches deal in facts and we deal in the unvarnished truth. And when it comes to the subject of today's debate, the list of facts that illustrate the appalling neglect and incompetence of the last 14 years is truly as long as your arm. But if we were to pick out just one statistic to summarise the last 14 years, you could choose this: that the most common reason for children aged 5 to 9 being admitted to hospital is for tooth decay. It is a truly Dickensian state of affairs. But you could also point to the UK's decreasing GP numbers, 1,500 fewer compared to 7 years ago, against the backdrop of a rising population. Or you could pick the collapse in patient satisfaction from 80% in 2009 to a shocking 35% last year. Or you could single out the fact that over 1,000 pharmacies have shut their doors since 2017, and that almost 6 per week left the market in the last year. Madam Deputy Speaker, the charge sheet is so long that a month of debates in this chamber could not cover the profound damage that has been done by 14 years of short-termism, sticking plaster politics, and a top-down botched reorganisation in 2012. The reality is that the Tories doused the house in petrol and COVID lit the match.
I thank my honourable friend for giving way. The reaction to a proposed ward closure in my local hospital in Rugby, the Hospital of St Cross, shows how concerned the public are about the health system after 14 years of underinvestment by the last government. In this case, however, the closure is because patients are being cared for closer to home. Does my honourable friend agree that bringing more services into the community and into smaller hospitals such as that in my constituency is integral to managing present and future demand and to put our NHS on a sustainable footing?
My honourable friend is absolutely right, and it's this strategic shift from hospital to community is going to be absolutely vital and central to our 10-year plan for the future of our health and care system. Madam Deputy Speaker, primary care is the front door of the NHS, but the Tories spent 14 years bricking over that door, and now it is walled off to millions of people across our country. So it falls to this Labour government to tear down that wall. And we know there's not a second to waste, not least on mental health. It is unacceptable that so many children, young people and adults are not receiving the mental health care they need. We know that waits for mental health services are far too long, and we are determined to change that. So we will recruit 8,500 additional mental health workers across children's and mental health services. We will introduce a specialist mental health professional in every school, and we will roll out Young Futures hubs in every community. Turning now to GPs, we will reopen the front door to the NHS by rebuilding general practice on the firm foundations it needs to get the service back on its feet and fit for the future. briefly.
The Minister for giving way. As well as needing more GPs, our GPs need decent premises from which to deliver high-quality care to patients. Park Road Surgery in my constituency has been looking for new premises for over a decade, serving 13,000 patients out of an old Victorian house. But the budgets are simply not there, and the processes are too complex. Will he commit to looking at both the bureaucracy but also pressing the Chancellor for more capital investment in primary care?
Well, as the Darcy review pointed out, one of the most egregious examples of the neglect and incompetence of the last 14 years was the underspend on capital. We're clear that a number of premises across the country can be repurposed. We do need to clear the bureaucracy out of the way of that, and as we saw the Prime Minister saying earlier this week, we will have a mission which is about smart regulation and clearing the bureaucratic barriers to change. Now, we're also cutting red tape, so GPs spend less time pushing paper and more time face-to-face with the patients they serve. And we're working to bring back the family doctor and to end the 8 a.m. scramble. Madam Deputy Speaker, we've done more for primary care in the last 14 weeks than that lot did in the last 14 years. On dentistry, we will introduce supervised toothbrushing for 3 to 5-year-olds in deprived areas, ending the national scandal of tooth decay. And we're rebuilding the bridges that they burned with the Dental Association, British Dental Association. We will work with the BDA, I've already met with them, and we will deliver a rescue plan that gets NHS dentistry back on its feet, with 700,000 additional urgent appointments starting as soon as possible in those parts of our country that need them most.
Thank you, Minister. Given the shocking state that the last government left us in, isn't it good that the grown-ups are now in the building and that we have seen the urgency needed in the NHS? The urgency of the commissioning of Darcy, the urgency of the £82 million investment, alongside the commitment to tackle dentists and pharmacies and reduce the unnecessary burden.
I thank the Honourable Friend for that intervention. I'd like to pay tribute as well to my Right Honourable Friend, the Health Secretary, for getting the strikes sorted within a week. Within a week of us taking power. What a change that has made, Madam Deputy Speaker. So we're going to reform the dentistry contract to make NHS work more attractive, boost retention and deliver a shift to prevention. Now, on pharmacy, as my honourable friend, the member for Bristol South, made clear, we will shift the focus of our NHS out of hospital and into the community, empowering more pharmacists to independently prescribe, freeing up GP appointments for those who need them most, because that shift from hospital to community is vital in terms of demand management in the primary and acute sectors. Madam Deputy Speaker, on the whole, this has been an excellent debate. But I find it absolutely extraordinary that not a single word of humility or contrition was uttered by the official opposition. Where was their apology for the fact they spent 14 years bringing our NHS to its knees? Where was the mea culpa for the way in which they spent 14 years scapegoating the workforce, dodging the tough choices and passing the buck? Where was the acknowledgement of the fact that they called the election and ran away from their £22 billion black hole and from the multiple crises in our public services? But, Madam Deputy Speaker, whilst the Conservative Party continues to live in a parallel universe, we on these benches are living in the real world. We are honest about the scale of the challenge and we are up for the fight. Because whilst the mountain before us is daunting, we are not daunted. Instead, we are focused on the future, focused on reform, focused on rebuilding, focused on shifting from hospital to community, from sickness to prevention, and from analogue to digital. So let's roll up our sleeves and let's get to work.
The question is that the original words stand part of the question. As many as are of that opinion say aye. Aye. Of the contrary, no. No! Division, clear the lobby.
The question is, as on the order paper, as many of that opinion say aye? Aye. Of the contrary, no? No. Tellers for the ayes, Tom Morrison, Susan Murray. Tellers for the noes, Kate Dearden, Anna Taylor. Order.
The ayes to the right, 80. The noes to the left, 337.
The ayes were 80, the noes were 337. So the noes have it, the noes have it. Unlock. The question is that the proposed words be there added. As many as are of that opinion say aye. Aye. Of the contrary, no. The ayes have it, the ayes have it. The question is the main motion is amended. As many as of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. I'll give the front benches some time to clear now, because we're now on to the petition. Leave quietly, because we do want to go with the petition, please.